Good afternoon. We're back in session, and for our first agenda item, we'll turn to the Healthy Responsible Students Committee, led by Mr. Reginald Keenan. Mr. Keenan.
Thank you, Mr. Chair. Mr. Chair, along with Wendell Hall, we are bringing before the board this week one action for first reading, and then action item, and then a discussion item. On the very first action on first reading, we're going to have Mr. Ryan Collins come up and talk about the proposed temporary rules for interscholastic athletics. Thank you.
Well, good afternoon, everyone. And I know I have a habit of opening my presentations on athletics with a joke. And as a former high school soccer player, I do get a real kick out of that sometimes. But we have a lot to cover here, so I'm going to go ahead and jump in. So the state board initially, as you all know, initially proposed revised rules on athletics back in September. And then on October 3rd, the General Assembly enacted Session Law 2023-133, which made further changes to the state laws governing athletics and requiring the state board to adopt temporary rules in time for the 24-25 school year. The law also requires the state board to request a consultation on the proposed rules with the Joint Legislative Commission on Government Operations by January 15th, which is why these rules are being brought to you all a little earlier, I think, than initially anticipated. So these proposed rules are designed to satisfy the new legislative requirements and address a number of different topics that we're going to go through in a moment. So you all have the full package of rules in front of you, and it's quite extensive. But the summary, I know I don't normally do a PowerPoint for these, but because of the extent of it, I put one together to summarize what some of the changes are going to be. I'm not going to go through the full rules, but mostly just the changes from what you all had previously approved. And as a reminder, this action before the board is simply to propose the rules so that they can go to notice and comment. There won't be a final adoption until sometime in March, so there'll be plenty of opportunities to make modifications and changes based on your feedback and feedback from the field. So let's see. If we can go to the first rule. So this is 201. Again, this is the definitions rule. You'll see that additional definitions have been added in order to provide clarity for other rules within the section, including a definition for aggrieved party, which is these are individuals, identifies individuals who can appeal the final decision of the administering organization. That was something that was specifically changed in the new legislation. 6E204, this is has to do with the administration of interscholastic athletics. This is the existing bulk of the athletic rule. And that has basically been pared down to just talking about administration of athletics generally. So per the legislation, it transfers authority to enter an MOU with administering organizations like the High School Athletic Association from the state board to the superintendent of public instruction. It adds provisions for reporting concerns regarding an administering organization to the superintendent. It clarifies that the authority to administer interscholastic athletics reverts to DPI in the event that there's no MOU in place with an administering organization. And it removes the provisions related to the appeals, which are now exist in a separate rule. 6E205, this is the student health and safety requirement that previously was in the rules but expired. And so this reinstates that rule and addresses issues like concussion safety and emergency management plans. And it clarifies that the requirements extend to all public school units, not just local education agencies. 6E206, this is the rule on athletic trainers, mostly makes minor technical amendments to the existing rule and clarifies that the requirements do apply to all PSUs participating in interscholastic athletics. I had a question that had already come up about the application to middle schools. The changes to the proposed language do not extend this to middle schools as of right now. If that's something that the board feels should be changed, it can, but right now it still would just apply to high schools participating in athletics. 207, this is the big one. This is the student participation or eligibility requirements. Some changes to what you all saw previously. For one, it restricts participation of students who receive priority enrollment in a charter school based on the school's hiring of the student's parent for fraudulent purposes. That was something that was specifically set forth in the new legislation as a restriction on eligibility. The new law also required the rules to include attendance requirements. And so what has been proposed here, which had been discussed in an earlier variation of these rules, is that if a student has more than 9 unexcused absences in the current school year, that they would be deemed ineligible. And that is essentially based on the truancy statute that requires the principal to investigate if a student has 10 or more unexcused absences. It cross-references the new biological participation requirements in GS 115C-407.59, and it also has removed the amateur status restrictions because those have been moved into the next rule. One of the things that the new legislation required the board to address was the issue of name, image, and likeness. I know this has been a hot topic not only in North Carolina but elsewhere. The recommendation for the board, at least at this point, is that the board's rules prohibit students participating in middle and high school athletics from receiving compensation in exchange for the commercial use of their name, image, and likeness. And the remainder of that rule simply recodifies the existing amateur status requirements from the current rule. 6C209, this is just recodifies the existing penalty rules. There's not been any change from the prior version of that. 6E.210, this is a new one. This was also specifically required by the new legislation, was to impose limitations on recruiting and undue influence. In short, it prohibits PSU personnel from subjecting students to undue influence for the purpose of inducing them to transfer to another school for athletic purposes. It also defines undue influence, and this is essentially modeled on the existing regulation that the High School Athletic Association has had in place for some time. And then lastly, 215, if you're wondering about the numbering, I was trying to leave a little space for future rules if they needed to be added. But this will be the appeals process, and so what we've done is taken the process for appealing decisions of the administering organizations to the State Board's Independent Appeals Board as its own rule. It transfers the authority to appoint the Independent Appeals Board from the State Board to the superintendent, and it permits any aggrieved party, not just a PSU, as is currently the case, from appealing those final decisions, and that's, again, part of the new legislative requirements for what has to be in the rules. The last slide is just sort of an anticipated timeline of when we anticipate these things going forward in order to meet the deadline to have these rules in effect by July 1st. Again, these will be the temporary rules. We'll go through another permanent rulemaking process over the course of the 24-25 academic year in order to have the permanent rules in place by July of 2025. So I know that was a lot and I went through it fairly quickly, but I know we've had a lot of conversations about this. I'm happy to answer any questions that have come up as best I can.
Anyone have any questions or comments?
I do. As a high school principal who works with this every year, I can tell you that we will need a lot more guidance that's currently in the legislation on Rule 207 as it speaks to attendance. What constitutes an unexcused absence and what does not, so that we're all playing on the same board. And then when we look at attendance within a specific current year as it's written, we would assume that all students start the fall semester eligible when we are to attendance, but then as you progress through the year, those add up. Currently, we use the previous semester as the guide for the current semester, but we would need a lot more language about how that would be implemented than is currently there.
Appreciate that, and that's the type of feedback that we're really looking for from the field, and for you all and for the public listening, just a reminder that there will be an opportunity to submit public comments through the rulemaking process. I'll be sure to, I'm happy to send you instructions on how to do that once that goes live.
Just to add to that, because I think part of what he's speaking about is, do the new rules suppose that a student athlete loses eligibility after the beginning of a season as opposed to maintaining it for an entire semester as has been previously the case? That will definitely increase the grievances that are heard as well.
Anyone else, comments or questions? If not, thank you, Mr. Collins, for your presentation.
Thank you all.
Okay, thank you for comment.
Ms. Banks?
This is not directly about the rules. NCHSAA has expressed some concern about the financial ability to go forward based on the statutory authority. And I would just say, as we look forward to a budget, if the superintendent is to have to undertake that role, there's a significant staff of people who work on that NCHSAA, and clearly the superintendent would need appropriate support to be able to administer this if that's the way it turns out. But I do think that's something we need to watch. It's only 6 months away.
Anyone else? Thank you, Ms. Collins. Mr. Chair, on the action item, HRS 2, report to the NC General Assembly, the pilot program to raise the high school dropout age to 18. As you know, this has been brought forth by Ms. Karen Fairley, and of course, due to the interest of time, unless y'all have some questions or comments, we'll move forward to the next item, if that's okay. Anyone have any question or comment that we need Ms. Fairley to come forward, we'll do that. If not, Mr. Chair, we'll move on to the last item for discussion, and then, of course, Dr. Essick will come and talk about HRS 3, the 2023 Healthy Active Children Policy Report, and the 2023 School Mental Health Policy Report. Thank you, Ms. Essick.
Thanks so much. Appreciate it. It's nice to see you after lunch instead of before lunch for a change. Appreciate you having us and let us be here. I'm here to bring you updates from the 2023 Healthy Active Children Policy Report, as well as the 2023 School Mental Health Policy. And both of these are due on September 15th every year. Both come out of our shop, Healthy Schools team. And so we've consolidated the request so that we're not bombarding schools with so many different requests. And we've tried to work collaboratively, as we do in that whole school, whole community, whole child framework, to work with them and only send one email at a time so that they're not so overwhelmed with trying to answer these. And I'm going to bring you highlights from both. You received the 2023 School Mental Health Policy Report last month, and it's also attached, I think, at least the PowerPoint is, as well, because it was due to the General Assembly in December. So it's been sent already. And then the Healthy Active Children Report, I'll go over the highlights of that today. And we'll use both of these to talk mainly about how we're supporting districts with this work. But I don't have a joke, but I do have an exercise that I would like you to participate in, if you're willing and able, to see how healthy we are. So I'd ask that, if you're willing and able, that you'd stand. And you're welcome to stand as well. You know, it is New Year's and resolution time and all that. So I'm going to give you some criteria, and as you fail to meet them, I'll ask you to sit down. And once you're down, you're out, at least for now. And we'll talk about it when we finish, all right? So you ready? And I won't remember 10 minutes from now while you sat down. So if you want to be honest with yourself or not, that's up to you, okay? All right. So if you smoke, sit down. Cool. If you're not within 10 pounds of your ideal weight, over or under, sit down. And that's your vision of that, not necessarily the charts, but what you know is ideal for you, okay? If you don't eat breakfast 4 out of 7 days per week, and a Pop-Tart is not breakfast, sit down. If you don't exercise 3 to 4 times a week, 30 to 40 minutes each time, sit down. And if you don't sleep 6 to 8 hours on average per night, sit down. Those of you sitting, I hope that you will applaud those people standing up. Thank you. Y'all can sit down. And the reason is they can probably add about 10 years to their life just based on their lifestyle habits alone. Now, if breakfast is the only thing that set you down, you're not going to die earlier. I'm just saying that's a general look at how healthy we are overall. And those are lifestyle habits, right? They're lifestyle habits that some of us are working hard to change because we didn't develop the good ones early. So part of the work that we're doing, that we're going to talk about in this policy, is how do we work with students when they're at young ages, before they've gotten to where we are, where exercise is still fun. It's not work like it is to many of us. When we think about, I've got to go to the gym tonight, they don't think that. When you tell kids it's physical education time, they're excited. They want to be part of that. So when we talk about this work, thinking about the work that our team does and the folks out in the field do to try to encourage students to be healthy from a very early age. And one of the things that I bring you each month are the ratios of specialized instructional support personnel, but I wanted to also highlight the ratios of physical education teachers. If you look at this in North Carolina in the elementary school, the average number of K-5 students per licensed physical education teacher is 372. Okay. The average number of licensed teacher for middle school students is 250. I think the words are in front of that, but if I remember correctly, that's 250. So I'm going to talk more about those in a few minutes and how that comes into play with some of our work. Also to talk about, since we'll be talking about the mental health policy and the Healthy Active Children policy, This is data we've brought you before, but I also wanted to highlight that again. If you look at the blue line, that's the percentage of students who felt so sad or hopeless that they didn't participate in their normal activities. And look from 2019 to 2023 how that's increased, 43% of our students. If you look at the green line, that's the percentage of students who have not been physically active 5 out of the last 7 days per week. And that has gone down. There's a correlation there. Can't prove cause and effect, but certainly a correlation. And what we need to see is those lines going in totally opposite directions. So as we talk today, we'll talk about the collaboration between the work we do in mental health and what we do in physical health. So I'll talk some about the Healthy Active Children policy first. Again, we do this in the framework of the whole school, whole community, whole child, working in all these areas, working together in the context of the community. The policy has 8 sections. I'll highlight just a few of those today because of time, but you have the whole report. Just some key points that I'll bring out to begin with. We had 100% participation, and that has improved, especially since we combined the reports. We're not begging and pleading quite as much, and that's great. Folks are responding to us. 50% of our school health advisory councils met at least quarterly. I'll talk about that. 72% reported their results to their Board of Education, their local board. And 63% of our schools provided staff wellness programs. Move on to that. That's just a placeholder. So the policy encourages schools to move toward 150 minutes per week of physical education taught by a physical education specialist, a licensed teacher. 36% of our LEAs say that all of their schools do that. And if you'll move to the next slide. This is a slide, and some of you may not be able, I can't see it real well from up there, but I think you have it in front of you, of the ratios of physical education teachers to students in different counties. And as the colors get darker, you see those ratios are higher. And just an anecdotal story, we recently had our Healthful Living Coordinators meeting, and you see the I can't see it from here, the darkest one, 758 or something like that, I think. There was someone from that county in our meeting when we showed this slide, and they said, how can that be? So they went back and they called their central office. It was this superintendent. Sure enough, that's their ratio. And the reason that was their ratio, 700 and some to 1, is because they did have more teachers. They were not licensed teachers. And that started a whole discussion in our group about what those teachers needed. They needed pedagogical skills. They needed classroom management skills. They needed to know how to write a lesson plan and write an objective. And those were the skills that they were begging us to deliver. So our whole team is rethinking what kind of professional development we provide now, and starting to work with our institutes of higher ed to come up with some pedagogical training for these folks who are coming in as teachers, but they're not licensed teachers. So it's important for health and physical education teachers to be licensed teachers as well. At the middle school level, the policy encourages us to move toward 225 minutes of healthful living. That's half health and half PE. 44% of our LEAs say that all of their students get that. But we asked them, in the next slide you'll see, to talk about what percentage is health and what's PE. And they say that about 58% is physical education, 42% is health. At the middle school, that's probably about right. It's not 50-50, but it's not bad. And these are the ratios at the middle school level. So you get a chance for each county. Obviously, the counties that are lighter are usually smaller districts, so it's easier to have the lower ratios in those. We ask our school health advisory councils, how often did they meet? Did they meet at least quarterly? And if you look at 2019, I think there was 55% of them met quarterly. That dropped off during the pandemic, obviously. Some of them met online during that time, but that's moved back up to 50%, and we're really excited to see that going back up. And part of the reason that's going back up, and I'll talk a little bit about funding, we asked, did they get any funding for their school health advisory council? 83% of our LEAs said they didn't get any. Not unusual, they never have. 17% said they got some, but this was local funding, and I think they confused that with the next slide. Some of them did. The funding that we're talking about is funding from the Division of Child and Family Wellbeing. They had extra COVID testing funds that the federal government allowed them to use for mental and behavioral supports. So we provided 44 LEAs with $60,000 each to help do their shack work. And I want to tell you, the excitement we're now seeing around shacks is amazing. people that have been, I mean, they're frustrated. They've worked for years and they do it with no money and they write little fuel up to play 60 grants and get a few $1,000s here and there. $60,000 made a big deal. They could buy curricula for mental health work. They could provide professional development for their staff. So much more they could do. So excited to see that some of them use that funding. We also asked them to do an assessment. What's going on in your district? What's going on with your health of your students? And most of them use their local wellness policy as part of that assessment. The other ones, a lot of other ones use our WISC assessment tool that we provide for them. And then how do they do those assessments? They use some reports to inform that work. Many of them use the report from the previous year, right? You see what you did last year and see if you want to improve on that. And also they use the Youth Risk Behavior Survey data. Every year we say, what are you working on? What are your top areas of focus? This year, number 3 came in tobacco and vaping. Last year that was school health services, and the year before that was school health services. Again, that was during COVID, and a lot of folks were doing a lot of testing and dealing with students who were ill. But tobacco and vaping came in number 3, a safe school environment number 2, and then mental health work number 1. And that's been the same for the last few years. We also ask our districts if they're providing employee wellness for their staff. 47 of our LEAs say that all of their schools get, and all their employees get staff wellness, which is interesting because if you look in the next slide, we ask where do you need the most help, and employee wellness overwhelmingly is where we've been asked for support. And that's not typically an area we provide a lot of support for, so we're having to do some work on our end to make sure we've got the right resources to help send out to schools. So the policy, Healthy Active Children policy, requires that all elementary schools provide 30 minutes of physical activity daily to elementary children. 99% of our districts say that all their students get 30 minutes daily, most of that through recess, and then some through physical education classes. When we move to the middle school, because this is a K-8 policy, that drops down to 76%, with most of that coming through physical education. I will add, though, that recess has been added in a lot of middle schools, and it's really pretty neat to see. I went to a school not long ago, and I was like, what are those kids out there doing? Like, it's recess. Middle school kids, just throwing balls, kicking a soccer ball, just getting some movement outside during the day. It doesn't matter how old you are, it helps to move around a little bit. One of the other requirements of the policy is that schools are not to use recess as withholding recess as a form of punishment or to use exercise as a form of punishment. 99% of our districts say that they don't do that. A few that said they did replied and said they were working with their teachers to have better ways to manage that. And then just a few of the policies we ask. We ask if folks are using, if they have joint use agreements, written agreements. Some do, but almost all have some kind of agreement, even if it's not a legal written agreement, joint use agreement. They use facilities. The community and the school share facilities. We ask about some other local policies. Legislation requires that schools have a policy around the Healthy Youth Act. 92% of our districts said that they did. There are also policy required around the School Violence Prevention Act. Bullying and harassment, and 98% of our districts say they have a policy related to that. And then this is a pretty big, and we said who receives the School Health Advisory Council report? Well, the policy requires that the superintendent sign off on an attestation form saying that they saw the report. So that number should be 100% right there. But that is reflective of about how many attestations we got back. So. Sometimes people just don't send them. And then we had some successes. And I'll just talk about themes in this next slide. Some of the themes and successes across the state from SHACs. A lot of our SHACs are addressing vaping. When we give the vaping numbers, everybody always says they're not high enough when we have the data on vaping. And I think folks see a lot of vaping. And we'll be talking more about that when we get the results of the Youth Risk Behavior Survey for 2023. A lot of them are doing mental health work. Again, a lot of them received funding to do that, so they're using some of that funding for staff and students. They're working more with community partners. They're getting more folks involved in their SHACs. It's really nice to see. This is the most excited I've been about this report and the work these folks were doing in a long time, because folks really are engaged. And you can look at that next slide with those pictures, a little bit larger. You can see some of those in your region. I'm happy to talk with you further when we have more time about what they're doing. Everything from Girls on the Run and the Go Far program in Dare County in the east to more members of their shack in the far west. And even Rockingham County, for example, I think they had a new employee wellness thing where they reach out to each other in the afternoon and say, hey, we're going to meet at this park at this time and go for a walk. And staff members show up and have some time together to just have an easy, relaxing time together. And they do other events too, but they've got a system where they just send out the notice, here's where we're going today, if you want to come, show up, which has been really nice. So some really great things happening in these districts. So that's the physical health. And talk just a bit about the school mental health policy. And you have the policy, but I want to talk about how we're helping districts and what we're seeing from them. The policy has these plan components that are required for each district to have in their plan, everything from a suicide risk protocol to a training plan. We had 336 total PSUs that received a request for the report, 327 reported. 8 of 211 charters did not report, and 1 regional lab school didn't report. So that just gives you an idea of our reporting structure for this. And just because they didn't report didn't mean we stopped asking them to help them. We still call them. We still ask them if we can help them with their report so that their next one gets in. These are the training areas that districts are supposed to do training in. You'll see that they're all setting up their trainings on these, and they go down from the top being suicide prevention down toward teen dating violence. As those drop off a little bit, part of that's not because they're not offering it, but because after the first 6 hours, it's 2 hours a year on different schedules. So sometimes folks aren't getting them all in the same year. So next year, when I come here, you'll probably see suicide prevention training down a little bit lower and teen dating violence move up on that. So we ask them questions. Do you have a plan to address your staffing ratios? 74% of our PSUs said they had a plan. And then we said, how's it going? And you see those numbers drop off a little bit there in terms of whether it's fully addressed or not. And again, that came back to funding for just about everybody. They're doing the best they can with what they have. And this is just a reminder of that. Since I showed you one ratio in the beginning, these ratios are our current ratios for counselors, nurses, social workers, and psychologists. And where we need to still do some work to get those folks to support us, get those folks support. And we need them because they do a lot of things, but there's 2 things that I want to draw attention to. One is the chronic absenteeism goes down when we have enough of those personnel. I think we talked about that this morning a little bit, and the need to look at absenteeism. But also the time teachers spend on instruction goes up. And the teacher turnover goes down because teachers aren't being asked to do the mental health work for their students. We have the right people in place. Teachers can do their jobs. So it's part of that whole school, whole community, whole child framework where everybody needs to be involved for students to be successful. So we have a process every year as our reports come in. The process is to review the report. And this happens over the course of the year. This is not all at one time. But over the course of the year, we review. We provide intensive reviews on the mental health plans. We provide feedback. We provide professional development. And then we remind people between May and September that we need to have their plan again by September. How we determine how much follow-up we give are the things on the left there. If a district or a PSU, doesn't have a plan at all, we call them and say, let us help you get your plan together. If they're missing components, we call them. If they don't have action items, if they don't have a suicide risk referral protocol, if they haven't been doing their training, and sometimes they just call us and say, I need help, which is wonderful. We're happy to help them any way we can. And I want to show you what that's done, what that's resulted in. If you look at the next slide, we worked with an intern from UNC School of Public Health who helped us create a rating system for the plans that we received. And for a plan to exceed compliance expectations, it needed to have model plans, it needed to be detailed, and it cannot be missing anything. So she helped us go through every single plan we had, 236 plans. And what we saw from that was these are the last 2 years that we've been doing this. In 2022, we had 12 plans, these are from LEAs, that exceeded what we needed for that plan. In 2023, we had 25, so we saw a 13 point increase in that. And as a result, some of the lower ones went down. Obviously, that's the way that works. If you look at the charters and the next one, we did a lot of work with our charter schools because they had not been used to doing this kind of work before. And so the first year, we only had 2 that exceeded expectations. In 2023, we had 21. So, and I think that's a testament to our school social work consultant, school counseling consultant, all the folks that are working every day, our school psychology consultant, to help folks create better plans. And those numbers don't all equal out, and that's because charters come and go, and so those numbers are not always consistent. And then finally, we said to them, what do you need? How can we help you? Well, the first 2 things we keep advocating for, but we can't help them because we don't have funding. They want consistent funding, and they want permanent positions. A lot of folks got positions with temporary money during COVID, but they'll be losing those positions pretty soon. So they won't have the positions they need. They want additional training. Through our work with Division of Child and Family Wellbeing, we receive some of that funding, and we have modules being developed for each of those 6 training components right now that'll be online and available for teachers to take. And if you skip down to number 6, one of the things they ask for is a better system for electronic data collection. And that's something we've been working with Dr. Wren and her team on to create an electronic health record system. And we've got folks using it right now, getting some good feedback on that, and looking forward to making that even stronger in the next iteration. So that's some of the things we're trying to do to support these districts. Because bottom line is our healthy children do learn better. We are part of that process, not just, I mean, math and science and social studies are all very, very important, and they're even better if our students are healthy and engaged in the class. So I'll stop there. Questions before we?
Questions, comments? Item 1?
Just real quick back to the data you gave about whether local funding is allocated to the SHAC, and then the next slide you asked about whether the SHAC received the $60,000. Were you saying that of the 17% that said yes, we get local funding, that you think most of those said yes because of actual the $60,000?
I think some of them did.
Not because there was actual local funding.
Yeah.
So are there any examples of actual local funding, and what is it used for?
I don't have any. I can look and see if we can find some folks that are using it. I think because the next question on the survey asked if you got that money, and some of them that said they had local funding said yes. We just think maybe they were a little confused about where that money came from.
Right. But because I think it'd be really helpful for districts to have recommendations around what the priorities might be for local funding to support a SHAC. And those could come from here, because there are plenty of districts out there that probably could allocate some local funding, but I don't know that, and then some that would need support if you were gonna allocate local funding. So I wanna be careful you don't create a have and have nots, but if there are ideas and best practices around how the funds could be used, I think that would be helpful.
I'm happy to look at that. And I'll say that there was a slide earlier on, and I should have mentioned, said, where do you give your report? And one of the one that was the least used was your local county commissioners. And we're trying to and we put that on there to hint to our districts that you should talk to your county commissioners. You should talk to some of your local folks and see if they can help you with some funding. We're not talking about a lot of funding, right, for
The money comes from, yeah.
a shack. But some of those other people on there, the health department, they're probably not gonna fund you. You know, it's like, where am I gonna get some funding? Possibly, but I will certainly look for those and not look back in our data and see if we have any of those examples. We do provide a training in, I think it'll be early May this year for our shacks, and we'll get more information from them there as well.
Just a quick question. So remind me again, a SHAC is a district-wide
Yes,
and representatives come from the school?
yes, so each LEA is required to have a shack by this policy, and that's district-wide shack.
But it is, correct me if I'm wrong, or else we were doing it wrong for many years. The School Health Advisory Council really is not like a representative from every school or everybody at central office. Our shack had maybe 3 or 4 people from WCPSS and 10 or 12 people from community groups. The
Yes.
local health department, from the Y, from other vested organizations in health and wellness. And the report was provided to the board every year. So it's not just an Inter-district.
So the policy has a list of required people that should be on it, and those include folks from your local health department, community organizations, because that's another place where if there's any funding available, they can help you find it, oftentimes.
Any more comments or questions? If not, Dr. Esser, will you continue with our guest from Wilson County?
Sure, I'll be happy to. So one of the things that the Whole Child NC has been doing for some time now is working on our priorities to bring to you in the next few years. And one of those priorities is to include and to increase access to school-based health. So I think we have some folks from Wilson County today. Mr. Mercer, Dr. Mercer, are you going to come and introduce your group? Thanks, sir.
Thank you. As always, it's a pleasure to see you. I feel honored to be here, but I particularly feel honored to be introducing Dr. Mills, Superintendent of Wilson County Schools, and Dr. Kim, that's instrumental in the day-to-day operations and seeing that our WASH program is successful. And WASH is an acronym for Wilson Area Student Health Clinics. And they have all the information. I've tried to be supportive, but they know what makes it successful and what makes it work. So at this time, I would like for them to come forward and share with you and hopefully answer any questions. Thank you.
Good afternoon.
Good afternoon.
I know it's after lunch, and if it's, your schedule's off from the holiday like mine, I don't know whether to sleep or just eat anything in front of me. So I'm really struggling. So thank you to the board and the state superintendent for allowing us to come and share very quickly today. I would like to start by thanking Rupin for all his help. He really made it easy to prepare and to get here today. But Dr. Kim and I wanted to share quickly with you information about our student health centers. And we've got a little bit of a different situation, and we really want to leave some time for her expertise to come through with some of the questions that you may have. But our WASH centers are really a cooperative effort between the county schools and the health department. And we currently have 4. The first one opened right after I arrived back in Wilson in 2017 at Forest Hills Middle School, and that was kind of our trial run. We had to figure some things out after that was already planned. Things like, well, there wasn't a bathroom planned because it was going to go down the hall. That's probably not a good thing when patients are needing to use the restrooms and things such as that. So these are the kinds of on-the-fly things you learn to deal with. Our 3 high schools, traditional high schools, now have WASH centers in them. Some of the things you may ask about, and Kim really loves presenting, so I would encourage you to ask all questions towards her. Parents and guardians or employees must fill out paperwork. Employees can go to any of the 4 centers. They don't have to go to just the one closest to them, or if that happens to be their school. And the one that really throws people off but is really important is that we've focused on both the insured and uninsured, and private insurance, Medicaid and Medicare, and here's the brains behind all that, without a doubt. But you can see I've tried to include some of the things they provide from well care on down. I think it's easier to understand what WASH is if you see what it looks like, and everybody thinks it should be some little Kim walking around in a lab coat and a little cart. That's what WASH looks like in a school, and if you can tell me where you see the school versus a clinic and the difference, you can't tell a difference when they're in our schools. Both of those are at high schools in our district. So I want you to see a lobby. The labs, same kind of labs you'd have in a urgent care center or private practice. Same setup, same everything. I'm not allowed to store my lunch in that refrigerator either. I tried that. I did ask for Diet Pepsi to be stocked. I didn't get that. Exam rooms, as you can see, may vary a little bit depending on design. One on the left was the first one. One on the right's at Hunt High School. But again, you don't know you're in a school where you're in the health centers. So I think it's important to be able to visualize that. So we want to talk a little bit about what's happening now. I cannot tell you enough as a superintendent, as a parent, as a spouse, how invaluable WASH was during COVID. If it had not been for Dr. Kim and the WASH clinics, it would have been overwhelming. Everything we ran into and all the other logistical issues we had were so better balanced through the cooperative kind of relationship we had with her and the staff to get through that with the health department as well. Telemedicine is now implemented. I won't even start. I'm a tech guy, but again, Kim can tell you about that. This is one that we talked about after a visit I had, I think when I nearly cut my thumb off over Super Bowl weekend 2 years ago, or 3 years ago, I can't remember. Anyway, she made me wash it, it really hurt. We were talking while I was crying like a baby about the DOT physicals and the fact we had bus driver shortages. And we now have someone who can provide DOT physicals, that being Dr. Kim, because we were running out of time for our folks to cycle through for the available classes. So there's all kinds of components like that. We are working on adding a mental health component, which we think is very critical. And that's a tough one to figure out and bring in. The Healthcare Foundation of Wilson, I want to give a particular shout out to. And there's a full page slide which is a shameless plug and they need it. They have provided funding for all the clinics, and they want to continue to add them in all of our middle schools. We'll be adding Dard Middle this summer. But yes, there's some startup costs with that, but the recoupment of that does happen. But the Healthcare Foundation has given us the seed money to do the physical piece that you saw, but then the ongoing comes through the parts and processes with the billing and so forth. So the mobile dental clinic is also an extension of this, all contained. Y'all know, we're familiar with the big RVs that pull up and tear up the lawn and everything else. And I mean, you need like a team of people to turn the corner and park it. This is all in one panel truck, big box truck. It needs one classroom with regular outlets to come in, turnkey, do it, come in, come out. And so we've started that as well. That began right after the pandemic also. So I think that what I want you to know is, and Kim, you chime in since I know, again, you're really contributing a lot by being so nervous. Medical questions are coming. You really need the right medical partner. If your staff and your students don't trust their provider, and they do trust Dr. Kim, and the follow-up piece is key, and the extra things matter, you can have people fill in on a contract basis or whatever. It won't work unless you have someone who understands how educators and parents are and students are about healthcare. You've got to have somebody with some relationship skills. Can't just be medical. It's got to have a relationship piece. You need somebody in the district that can be a strong champion for things when they happen. Stuff's going to pop up when you do this. You can't wait for the next meeting or 6 months to resolve it. You need to get it done if you're going to get this going, if you're going to provide these services. And we've had to do some of that. The cooperation and communication with the health department, school system is really important. And it doesn't matter who gets credit. You better forget that. But you need to have good relationships. And that can get tough at times because there's turf battles still, timing of things. And Kim's a health department employee. I'm a school system employee. I'd still in a minute, but at the same time, I got to figure out what to do. So we're always working through that. You have to figure stuff out. Again, things happen. Funding support's been huge from the Healthcare Foundation. You need a school board that's going to take a chance on this and understand there's going to be some roadblocks and occasional questions about what you're doing and why you're doing it. So that's important. We have had that support from day one, and it has been imperative, and it has been huge for us to build upon that. Maintenance and principals have to be partners in this too. You're taking over somebody's space in a building. Principals, as we know, are very introverted and shy people. They don't share. You know, high school people especially, they don't have an opinion about anything. They're very easygoing. So it's always good to go inside. I'd like to take these 3 classrooms and put it at the back door, and I'm going to do it this summer. There's not much you can do. You really need to bring them along with you, and the maintenance staff are doing a lot of the work for us and tying that in, and there's always additions with that. So those are things we've learned as we've gone along too. Some of the growing pains I think that people need to know from the reality is I do worry about staffing from the medical side. There's one of Kim, you're gonna have 4 programs, there's more coming, there's telemedicine. There's a limit between her charting and doing everything else, and it's a lot. And their shortages are just like our shortages. So I try to make sure she's taken care of with, all the parking and had put up signs for personal park, no, I'm kidding.
For our patients to park.
For your patients, that was it, it was for your patients. But you try and take care of your staff. Sustaining the program is more about relationships, communications, rather than sheer funding, but you gotta have that seed money, and you gotta have some commitment. There are some local funds you have to do occasionally with some things, if there were some things that this one's gotta figure it out, but the bulk of it came from the seed money from the Healthcare Foundation. After that, it's kind of self-driven from some of the health department side. If you're consolidating schools like we are, we have to plan for that, because it's taking up class space. And once we put them in there, we don't want to take them out. And another one we ran into was, you're bringing people across campuses in and out. You need to make sure who's coming in and out of your buildings. We have a badge system and some other things that works for us. What about the people delivering meds and labs? They don't want to walk through the entire high school to get to the clinic. That doesn't make much sense. It's not very safe. So we had to go back and add access and make sure there's cameras and things such as that. So those are some of the kinds of things you'll run into. So again, big shout out to the Healthcare Foundation of Wilson. So far, $1.65 million. They've committed more. They're awesome partners. And I just wanted you to know that up front, that seed money got us started. But in my opinion, I think this is something that should be available to all students in all schools. This is an agreement and a relationship piece. There's ways to do this, but it does make sense for our families and our students. This has been a huge way for us to keep teachers in schools, students in schools, for parents to know their kid can go down and visit. They're informed, they know what's going on, but our teachers are not sitting in an urgent care waiting 5 hours, missing instruction. And we're keeping people, and we're different. We've got something that others won't, which in this day and age will not hurt us to try and recruit and retain people. But it is, first we had to explain what are we doing, how are we doing this, so people know. Physicals, we ran into some roadblocks. You have to change the ways and give up some of the turf battles, but it does work. And again, the people make the difference. But Kim, you want to add anything since you've really
Sure.
kicked in?
I just want to add one thing. Have y'all ever done telemedicine with a provider? And has it been just like on the computer, like FaceTime, or? So one of the things that I really think is really neat. So I can be at, say, one high school and a nurse be at the middle school, and we can look in ears, look in throats, not only do flu testing, strep testing, but I can actually listen to the patient's heart and lung sounds. So it's called TytoCare. It's a digital stethoscope, digital otoscope, and it really kind of ties it all together. So when we say telemedicine, yes, I do telemedicine also. A teacher may be at an elementary school and say, I think I'm coming down with the flu, that sort of thing. But I can't do any point of care testing when that teacher's still at her or his school. But if they come into one of our clinics, no matter where I am in the district, I can do the telemedicine component. So that's really helpful. A kid may be wheezing, having an asthma attack, we need to send them over to the emergency room or give them an albuterol treatment. So it's a little bit more than telemedicine, and that's really been instrumental in helping us see as many kids in a day's time, because like Dr. Mills says, right now we only have one provider, and that's me. We are at the point where we're growing so rapidly that it's hard for me to keep up and follow up with these patients. It is really important to me. Once they start coming to us, we want to make sure we maintain those relationships. But yeah, does anyone else have any other questions for me about how our school-based health centers work or any challenges? Yes, ma'am.
I just have a quick question about the telehealth. Are you finding that people are responsive and receptive to the availability of telehealth? Are they taking advantage of it?
Yes and no. Sometimes people are like, no, I'm coming to whatever school Kim's at. I'm driving across the county, whatever. So we try to, if they're requesting that, we try to do that. But some days there's just not any available appointments because I mostly have one nurse with me also at whatever school. So we try to disperse. It's almost like, we have a control tower, and that's our hub, and that person answering those phones sends the patients to wherever the least amount of people are. Yeah, it's like a traffic controller.
It is.
So, and if they don't want to do the in-person, most of the time they'll say, okay, and then once they see the telehealth or the TytoCare, because they actually see on the same screen in the room with the nurse, they see me, and they also can see in their ear or the back of their throat, say if they've got strep throat. So then they're like, this is really cool. When I started this, I just had a plain stethoscope that I used in clinic, and I thought it was great. And once I started doing this, I could hear so much better. So I actually now have the Core. You might have seen it advertised, but it's like a amplifier on my stethoscope because it is so clear through the equipment. And I tried to demo it today, but Ruben turned me down. He told me I didn't have time. I'm gonna get a nurse. We can be in Wilson. I can be here and demo because it's really amazing.
I think it was those hacking charges you had a while back.
He was afraid I would
access.
crash the internet, but no, it's
Yeah,
really
we've
amazing. I
pulled
mean, I
up.
wasn't gonna do a real patient. I was gonna get one of my nurses to demo it, because we are open today, but it's, I mean, if you can look up Tyto, TYTO Care is the name of the equipment we use, and, it's crazy what we can do across.
I think that's important though, when folks see it after they've seen some of it, do take advantage of it. Just the unknown.
I don't wanna get too far in the weeds, but who does your billing? Is that the?
It's, so I'm employed by the health department. The Healthcare Foundation, you know, is our funding for original setup, then we bill. So we're on a sliding scale fee, uninsured, have to submit their parents or their, you know, if they're over 18, their pay stub. And then it's a sliding scale fee, and then we bill all insurances also.
The second thing was, a hospital was sold in Wilson, that's where the money came from.
Yes, sir.
Mhm.
Mhm.
Yep.
Yes.
Who's after that?
Yes, I do have a quick question, a couple, in fact, they may be related, but I would imagine these clinics would need to undergo some periodic, inspections, like from the health department or some
Oh,
other
yes.
agency.
Yes, so since literally we have the same policies and procedures as the health department, so we're treated just like the health department, so they come through and do our inspections. And then we work closely with the maintenance, department, cause we have, vaccines supplied by the state, so we have to have regulations on the temperatures and the alarms, and so all of that is constantly being monitored.
And then also the level, is there some level of, like maximum level of treatment or care that's assigned or defined for these type of clinics? I
When
mean,
you
how
refer out.
extensive are your services?
Oh, yes, ma'am. So we don't have an x-ray machine or an ultrasound machine, none of those things, but we see sick visits, well visits, we do all the labs, point of care, strep, flu, COVID, all those testing. So if I were to do a physical on a kid that's wanting to play a sport and I heard a murmur, I would refer out to a cardiologist, because obviously I don't have that expertise. And then if there's ever a time in the school that we feel that the patient is, we send them to the emergency room or to an urgent care. We've had to do that several times, of course.
Do you go in the area of pregnancy
No, ma'am.
services at all?
No, ma'am.
None whatsoever?
We don't provide any, birth control, any pregnancy testing, unless it's for our teacher and it relates to a medication that I'm prescribing. Some medications you have to, not on children, not on our students.
Thank you.
I know that you all probably can't answer this question, but perhaps Dr. Essex can. There are a lot of, not enough, but there are quite a few school-based health centers outside of Wilson.
Yes.
What would be the funding, you have the startup funding for the equipment and the facilities from the local level. What are the other ways that these clinics are able to get started?
Sure, WISH, which is in Wayne County, I know the most about that program. They are funded from a private sector, so like pediatricians in that county fund them, so they're employed. I'm not sure about the western part of the state. I know there are a lot out in the western part, and when I came in 2017, so all the research and all the groundwork had been done at that point when I joined the team. But they did go out to the western part, and I know they use telemedicine a lot also, and that's kind of where we made our, how we make our program is based on that. They're also funded through the local health department, but I'm not sure about any other ones. I don't know how they're funded.
Anyone else?
Okay,
Mhm.
Trust Foundation, somebody's got to give that
Right, the
bolus of
initial
cash
start.
up front.
I can just add, there are, North Carolina, the state does provide some seed funding for school-based health clinics. It's not enough to keep a school-based clinic running. on a regular basis, there has to be additional funding. But you can apply, districts or counties can apply to the state to get that initial seed funding to help them get their school-based health clinic started. But then they need these kinds of partnerships to keep that moving.
I would think that most county health departments would be happy to have that kind of partnership once you get the location set up and the.
I'm sure they would, and then local hospitals or folks that have the kind of funding they would need to keep the health center going, especially until they can begin doing a billing process to get reimbursement for some of the services.
Yeah, the first 1 to 2 years was very slow with us getting
Mhm.
going and billing, but now, you know, I'm seeing between 20 and 40 patients a day that we're billing for, so.
So I just want to highlight something, as Kemet said, about why your local health department or other, you know, hospitals would want a program like this to exist in schools because of the sort of the sharing of the burdens and that sort of thing. So that they're not as many people using an emergency room or overwhelming
That's
doctor's
exactly right.
offices. I think that's a really important point, but I also think you have to think about the context of the nursing shortage in general, whether or not what your existing playing field is in Wilson. Do all your schools have a nurse already on site?
No, not all schools, no. We're in the abbreviated ratio as well, too.
Right,
Yeah.
right. So I think, and I'm not sure how many districts, I think that would be some really nice follow-up, do actually have a nurse in every school as is recommended. Because I don't think that is as prevalent as it probably should be, obviously, but the relationship with the health department, and I think about the large urban districts when I was looking at the map, most of them didn't have stars. Because the health department in a larger, more metropolitan area may have a more prevalent shortage of nurses just to deal with the general population and in the hospitals and in doctors' offices, and for them to really see the opportunity in expanding and spreading resources out into a school system and how it helps them with their caseloads and burdens in hospitals and emergency rooms and other places. There's a relationship here that I'm not sure we're taking advantage of framing properly in terms of why it's helpful for the health departments, even when they are facing a shortage of
Right.
nurses and others, to engage in this type of activity.
Yeah, absolutely. Kids have to have parental consent signed and turned in before they can be seen. So if a child's in class, they start having a fever, they walk down to our clinic, and we don't have that parental consent. We have tried to call the parents, and most of the time they won't answer from us at the office, but they'll answer the kid's cell phone. So they'll say, "Hey, Mom and Dad, I don't feel well. I'm at the clinic, but they can't see me. I don't have a signed consent." "Oh, no worry. I'll pick you up and take you to the emergency room." I'm like, "Oh, no, we can take care of this here. It's probably flu or whatever." So a lot of our kids do use the emergency room as primary care. And they also use urgent care for their sports physicals at the ninth hour when they're expiring the next day. So that's something we try to work on.
Anyone else before we conclude? I'd like to thank Dr. Mills and
Thank you.
Dr. Kim for the great work you're doing, and thank you for coming for us today. Mr. Chair, that concludes my report.
Thank you, Mr. Keenan, and thank you, Mr. Mercer, for coming back to visit with us and bringing members of your fine community. Appreciate it. I'm sorry?
And the pie.
Oh, yeah, and the pie. Best wishes. We'll now move to the Educator Standards and Practice Committee led by Dr. Olivia Oxendine. Dr. Oxendine.
Thank you very much. I am Olivia Oxendine. I chair the ES&P committee. And joining me in that responsibility is Dr. Donna Tipton Rogers. And I guess it's time for another joke. Ryan, you have the first item on the agenda. This is an action. This is an action.
This is what I get for setting expectations.
Action. I'm sorry to catch you off guard. This is an action on a first reading, and it pertains to, again, it's a rules issue, a rules update, and the subject of this rule is the standards of professional conduct. So Mr. Collins will take us through this presentation.
Thank you, Dr. Oxendine, and I was literally just sitting there thinking if I needed to come up with a joke, but this is a slightly more somber topic, so I'll save that for next time. I'm here to discuss a set of proposed rules for 16 NCAC 06C.600. These are the standards of professional conduct. For some background, the Protect Our Students Act Session Law 2023-128, which became effective on December 1st, expands the applicability of the criminal statute related to indecent liberties with a student and increases penalties on school personnel who fail to report certain misconduct by educators. I want to acknowledge Superintendent Truitt, who championed this legislation and was instrumental in its passage. The legislation also gives the State Board of Education authority to adopt temporary rules to implement the requirements of the legislation, to address disciplinary action against professional educator licenses, and to modify the standards of professional conduct. As it so happens, the standards of professional conduct, which are codified currently in Rules 601 and 602 of that section, are among the State Board rules that have to be readopted within the by June 30th of 2026 as part of the periodic review process required under the Administrative Procedure Act. It's worth noting those standards have not been updated in about 25 years, so it was due for a refresh as it was. So the Office of General Counsel is recommending using the temporary rulemaking authority in the legislation to both update and readopt the standards of professional conduct and to adopt new rules governing disciplinary action against professional educator licenses. And as the person in our office that oversees this process on a day-to-day basis, I can personally vouch that these changes are needed. And also note that Pepsi reviewed and favorably recommended these proposed rules at its meeting on December 14th. So if we can go on to Mr. Fafaria to Rule 601, I'm going to go through these one at a time. A lot of the changes here are intended to provide greater clarity and to reflect existing law and practice with how this process works. So Rule 601 is an existing rule that's going to be readopted pursuant to the Administrative Procedure Act. It cleans up some of the existing language, and it specifically adds a definition section for some of the terms that are commonly used throughout the rules. 602, this is the bulk of where the actual standards of professional conduct are. This was something, these were substantively updated with help from Dr. Tom Tomberlin and Dr. Kim Evans in the licensure section. So a lot of the substantive changes were done with their input, but it is also due to be readopted. So it cleans up some of the existing language. It reorganizes the standards for more logical flow. It also defines solicitation or encouragement of a romantic, physical, or sexual relationship with a student. This was based on model language that was approved by the National Association for State Directors of Teacher Education and Certification, which is the national group that our licensure folks belong to. They approved that at their conference over the summer, and it was introduced during our attorneys conference that we attended, our national attorneys conference that we attended over the summer as well. And so that's where that language comes from, in order to just provide a little more clarity and guidance on reviewing those types of behaviors. And it also clarifies, and we had great input from Pepsi on this, about the nature of remunerative conduct and what types of remuneration or gifts that teachers can receive. And really the focus there became on making sure that it's not being done as a quid pro quo, not giving something to an educator in exchange for some sort of favor. So that's what that was intended to capture. 603, the remainder of these are going to be new rules that are substantively replacing the existing set of rules. So 603 will substantively replace Rule 6C 374. It's updated to reflect both current practice and the requirements of the APA. 604, this addresses the circumstances under which the state board or the superintendent, acting pursuant to her delegated authority, can deny, or I'm using the term here, sanction a license. This substantively replaces Rule 6C.0372. It clarifies that a licensee may face disciplinary action against the license for violating the standards of professional conduct in addition to the other grounds for action. And it powers the state board or the superintendent to deny an application, or again, we're using the word impose disciplinary sanctions here, as opposed to just limiting it to suspending or revoking a license, and I'll talk more about that in the next rule. 605, this is a new rule. It doesn't really have a concurrent counterpart, but it specifies all the possible disciplinary sanctions that can be imposed, which also includes written warnings, reprimands, and remedial actions. And so what a reprimand, just for some context, that differs from, say, a suspension or revocation, and that the teacher's license remains active, but there is a public reproach, a public reprimand, if you're noting that behavior, that they've engaged in some behavior that is inappropriate. It also codifies in rule the power to summarily suspend a license pursuant to GS 150B-23C. when necessary, quote, for the public health, safety, or welfare. And this is a power that's conferred upon licensing entities such as the State Board, and that a number of other occupational licensing agencies have in their rules. And really, I think here in conversation with Superintendent Truitt, the goal is to use this in those circumstances where an individual is facing serious criminal charges, say for indecent liberties with a student or sexual misconduct, that if they were convicted of those charges would result in the automatic revocation of their license under state law. And so the intent there is to provide a temporary solution, a temporary suspension until such time as those criminal charges can be resolved and a proper final decision on the status of their license can be entered. And then finally, it clarifies the obligation of the State Board to report certain disciplinary sanctions to NASDAQ, the National Association, in accordance with the interstate licensure agreement that we have with the other states. Rule 606, this is voluntary surrender of a license. It replaces existing Rule 6C.375. It codifies current practice of giving the educator notice of a proposed revocation. So when a teacher voluntarily surrenders their license, that has the same effect as actually revoking the license. But they are not entitled to the full process of petitioning the Office of Administrative Hearings for review because the agency hasn't taken any action. They have voluntarily surrendered the license. But we still want to give them that opportunity to know what the final decision is going to be. And likewise, these types of actions are also reported to NASDAQ. Rule 607, this is reinstatement or reconsideration of a license. It substantively replaces Rule 6C.0376. It establishes a process for requesting the reinstatement of a revoked license or reconsideration of a denial for a license or an application in all circumstances. The current rule really just specifies a very narrow and frankly kind of ill-defined set of circumstances under which a license must be reinstated. And so the import of this rule was to be able to comprehensively address all requests for reinstatement or reconsideration, and that those would continue to be in the discretion of the State Board or the superintendent. And it also establishes a minimum waiting period of 12 months before submitting a request for reinstatement or reconsideration. That's 12 months after the final decision has been entered. And then lastly, Rule 608, this is reporting requirements. Again, this replaces an existing rule, .373. It reflects the changes in the new legislation. It clarifies that all public school units, not just local education agencies, are required to report certain types of misconduct by licensed educators specifically. So the board, it doesn't extend to unlicensed personnel within the State Board within 5 days. And those are the things like child abuse or sexual misconduct or any of the bases, the types of crimes that would result in an automatic revocation of their license if they were convicted. But then it specifies that for all other types of misconduct that may justify actions such as dishonesty or improper acceptance of gifts, things like that, have to be reported within 30 days, just to ensure that school districts are still being timely in making those reports, but have more time and able to do that. So those are the proposed rules that are before you. You'll also see the proposed timeline there. That hoping to be able to get these in place within the next few months on a temporary basis, and then we will continue with the permanent rulemaking process thereafter. So these, again, are proposed rules. They'll go through, if they're signed off by you all today, or tomorrow, they will go to public notice and comment, just as we discussed with the athletic rules. So, Dr. Eisenstein, that concludes my prepared comments.
Thank you very much. This is a very important item. I would like to open the floor up for any questions or discussion that you might have. One question that I have, just a point of clarification, it may be 604 or 605. It has to do with, am I understanding this to mean that an educator can be put on suspension before
Conviction?
Yeah. Mhm. Is that stated?
Right. So the idea. So the way the rule is written, it says when the public health, safety, or welfare necessitates that. That's based on the statutory language. And in conversations with the superintendent, the idea is that if there is sufficient evidence to charge someone with a serious crime, that if their license was revoked, would be automatically revoked, no right to a hearing in the event that they were convicted, that is serious enough that in the interest of protecting students in the public school system, that their license should be suspended. Again, this is not a final action. If, say, that person were acquitted, they would have every opportunity to go through the usual process
Right.
to determine whether any action is warranted. But at least to provide an opportunity to ensure that if there is at least a reasonable possibility based on the criminal investigation that they've engaged in this type of misconduct to ensure the safety of the students in the schools.
Thank you very much for that clarification. Vice Chair Duncan.
Is it suspended with or without pay?
This is for their license. The employment matter is completely separate. That would continue to be with the school system.
I'm assuming if they don't have a license because it's suspended, however, the effect would be the exact same as it with or without pay.
That is if they were to be hired back in another school district. I think in practice, they're unlikely to be hired if they have pending criminal charges. But could be circumstances where that's not the case.
So the rule at least does not declare one way or the other about that. Just focuses on the license.
Right, it's just focused on the license. They could still, if a school district chose to hire them, that would not prohibit them from doing so. Obviously, if they have a suspended license, they would not be entitled to those benefits.
It would not be uncommon in this circumstance for the district to suspend someone. But that's different than not hiring them. They would not necessarily fire them. And then it would be the question as to whether the suspension is with or without pay. That could arise, I think.
And I think that would ultimately be an employment issue, not a licensing issue.
Okay.
Which raises a question in my mind, and maybe there's a very simple answer to this, I don't know. But now I'm thinking about, and maybe it seems like I read somewhere in the PowerPoint, there's a definition of a school employee somewhere in this body of information. I'm thinking about the educator who is teaching, in the classroom teaching, without a license. So would that definition of school personnel hired by the district, is that the way that would be applied?
So I think you're thinking about the definition of school personnel that's in the criminal statute. So it differentiates between different types of school personnel within the criminal statute. But because the state board's authority is limited to licensing, there's no obligation to report, generally speaking, no obligation to report non-certified personnel for these types of things. I know some of talking with Ashley Becerra, I know some charter schools have it in their charter agreement that they have to report criminal charges involving any kind of personnel, but that's an internal reporting requirement. That's not a licensure issue.
All right, very good. Other questions or comments? Thank you very much.
Thank you.
And so in that item, board members, it says it is recommended that the State Board of Education approve the following as a proposed rule to submit for public notice and comment. And you see those three bulleted areas underneath that sentence. And so that's what we are acting on, action on first reading. The next item is an action item. It was presented last month, and this pertains ES&P 2, and this pertains to several categories of teachers. We are considering changes, requirements in their licensure renewal process. And let's see, Dr. Tomerlin, you want to just take a minute and refresh our memory on this item?
Good afternoon, board members. I am here to refresh your memory on the policy changes for LICN 005, which deal with teacher renewal. So these changes come as a result of the most recent appropriation bill in which the continuing education requirements were altered. And also there is another policy related to national board certification and the renewal credits obtained through that process. So first, the changes to the continuing education requirements. The legislation now disallows the categorization of CEUs into specifically for digital teaching and digital learning competencies. So previously, each teacher was required to earn 2 of those credits. And that just allows that specificity in the categorization. So what we have proposed is that we redistribute those two categories into different categories based on the school level of the license. So for elementary, those two DLCs will now become 2 general education credits, where the teacher can use anything related to pedagogy or their content area for the purposes of renewal. They could use digital learning competencies to fulfill that requirement as well. And next we have the the secondary, 6 through 12. They did not have the literacy requirements, so those two have just been equally distributed between the academic subject areas and the general credits for digital learning. There's also a note here at the bottom of this that stipulates that any training required by the state or by the PSU as a condition of employment must be allowed to be used for the renewal process if the teacher can use those in the general education credits, or if they pertain to the content area, they could use those as well. And so the feedback we've received on this is a very positive change to the law, so we're excited about that. So for teachers who complete the National Board certification process, their initial certification process, they may earn all 8 renewal credits for that cycle. In the districts, there has been this apocryphal practice of allowing teachers to bank that for they earn it in one renewal cycle, and they can hold on to it and apply it to a future renewal cycle. For some reason this year, we received lots of questions about this, so we did the research, and there's no basis for this practice. It seems antithetical to the idea of professional learning and continued professional learning, and so we make it clear in this policy that those credits earned for renewing or completing the National Board must be applied in the renewal cycle in which they were earned. You cannot bank them for future credit for future renewals. And this is just a general, we're updating the matrix in the policy to show the new requirements for K-5, 6-12, and student service personnel and administrators.
Questions or comments? If not, excellent. And you may just stay put for another minute or two, and we'll go into the next item, which is a discussion item pertaining to ES&P 3, and this is we're going to look at some final numbers and dollars that will be awarded to our school districts who have been privileged to have the funding through the advanced teaching role legislation.
Yes, ma'am. Thank you. So as you remember, last month I brought you the selection of programs to be admitted to the newest cohort of the Advanced Teaching Roles program. I will get to those folks in a second, but just to refresh you of the law, the law required us to issue a new RFP and to consider the new funding, $2 million we received in this fiscal year. We also had the requirement to authorize New Hanover County as an ATR program, and then the law also defined adult leadership and classroom excellence roles and provided state-funded salary supplements for those positions in the amount of $10,000 and $3,000 respectively. So here's a definition of those advanced roles. Adult leadership teachers, of course, they work in the classroom providing instruction for at least 30% of the day. They lead a team between 3 and 8 teachers, and they share responsibility for the performance of the students of all teachers on their team, and is not a school administrator. And the classroom excellence is identified as an advanced teacher and assumes and maintains responsibility for at least 20% additional students versus the number the teacher had prior to taking that role, and is a member of the team of teachers led by an adult leadership teacher. So those are the criteria. To remind you, we had a recommendation. We modified that recommendation, and so this shows you the 5 districts that were, in addition to that, New Hanover County, but the 5 districts that were selected by the state board for inclusion in the ATR program. And they are Chatham County, Guilford County, Moore County, Columbus County, and Cabarrus County, thank you. And there's the funding totals, the grant proposal, budget totals for each of those, and how it fits into our funding model. So this chart, a little difficult to read, but initially what I reported, I suggested to the board was the first column to the left there for the 23-24 funding for this school year. For those programs, it gave a certain amount of money for planning to those selected districts, those newly selected districts, as well as the funding for New Hanover County schools. To the far right, highlighted in orange, is that revision, where we've taken those extra funds, about, I think, $800,000, and equally distributed them between the programs that were in prior cohorts. And you can see the new level of funding on the right, with additional funding for all the districts in continuation, and also for those that are still in active program status. And so when we tally all that up, you can see there that the total expenditures for this year leave us with $1.48 in the bucket. And so we're happy to get all that out to the districts.
Excellent.
And I think
Question, Ms. Kamens.
I just have to ask this question, looking at the line item for Wake County, why is it so hugely more than any other?
Well, Wake
Not the
County is
size,
substantially larger than most of our other districts. So it's generally, the program size will dictate, not always, but often, the program size will dictate the amount of the funding. I'm sorry, was that your question?
Yeah, but it does, I don't see that reflected anywhere else, that there's a huge disparity in the size of the.
Well, so Charlotte-Mecklenburg is currently in a continuation funding, but their original proposals, they were large, as was Pitt, was fairly large. It wasn't quite $1 million a year, but it was substantial. The larger districts do often have much bigger program requirements.
Okay, so they're not Wake is not in continuation funding at this point?
No, they're in active funding
Active
now.
funding, okay, thank you.
Yeah.
That wasn't clear to me.
Oh, I'm sorry, yeah.
Okay.
Are there other questions?
Well,
Vice Chair?
that sparks one. Guilford County's not nearly as large as Wake, but the differential represented here is significantly more.
Sure.
Can you use that as an example to help us better understand how that differential happens?
Right, so the districts, they provide us with their budget. And so, but one thing about Guilford County that's unusual is the Guilford County is exercising its option to do a second round of funding. So they had funding in the initial 3 years. They took a year of continuation funding, but then reapplied for another 3 funding cycle for this year. And they were awarded, their proposal was awarded. It's a little bit, yeah, it is smaller given their size, but I'm not sure why it's smaller than one would expect given their size.
And follow-up, if I could, on one other, I'm just having trouble following the chart on this. New Hanover, which I understand is first year, was designated by the legislature, has $436,000 for each of the 3 years, but the total at the end is $484,000. Can you explain that differential?
Sure. So when we distributed if you look at the first column with the available, that remainder number, we took that number and distributed over the active programs. And so we added the same amount to New Hanover that we did to Wake that we did to all the other the programs above that line. So all the programs above the 150,000 mark are either in continuation or they're still inactive. We distributed that excess money, that 861,000, equally between all those above the 150,000 mark.
So was New Hanover already in existence, or is that a
No,
continuation?
the final column is the revised for 23-24 only.
That's right.
So it would have been 436 for 23-24, but it will be 484.
That's correct. New Hanover is a current active program because they were identified by the so they're different than where we start with Chatham with the 150,000.
Right.
Those are approved for the 24-25 school year. So the $150,000 we're giving them is planning funds for the remainder of this fiscal year, so they can be ready to implement. That's when their actual 3-year installments will begin. Everybody above that line is a current program in this fiscal year, and that's where we decided to redistribute all the 861,000 equally between all those programs that were current active programs in the 23-24 school year.
So when was New Hanover, I'm just a little confused.
Sure.
Just want to understand. When was New Hanover put into the program that would make it be inactive this year?
This year.
So with the appropriations bill, it stipulated that if New Hanover submitted an application that met the state board requirements by July 1st, they were admitted to the program, and they did so.
So they've been active for most of this school year, is that what you're saying?
They have been active technically they've been active since August 1st, but they've been doing so without any funding from the state because the budget just was certified a couple weeks ago, and we haven't gotten this money out to any of them yet.
I wonder if it would be useful, Tom, Dr. Tomberlin, since we had so many questions coming up around how the decision-making process in terms of how to appropriate or allocate the funds, if you could do a quick maybe a written synopsis to lay it out for us, perhaps have it tomorrow. Is that
Sure.
possible?
Absolutely.
And that might resolve some of the questions.
Do you have a question?
Yes, there's a question to my
I
left.
just wondered how many applicants you had for the program?
There were-
Like districts, how many districts?
This time there were 8.
We were one of the districts who applied and didn't get it, so I just
Okay.
wondered how many there were.
Yes, there were 8. I anticipate next year, with the advent of the supplements being paid by the state, I would anticipate we'd have a lot more next year.
Just to ask my colleagues, will that be helpful to have some kind of explanation of decision-making process? If you can do that I
Sure.
don't want to add any homework to your list.
It's fine.
That might
I'm
be
happy to
useful.
do so.
Thank you. Other questions? Thank you. Then we'll move on to the last 2 items. Under discussion, ES&P 4, and Dr. Seibert will be presenting these 2 items. Has to do with the applications of 2 entities that are coming to us today in discussion, the discussion portion of the agenda for authorization to operate as an EPP.
Thank you, Dr. Oxendine, and good afternoon, everyone. The first, I'm bringing 2 programs, as you mentioned today, for you to consider for initial educator preparation program authorization. I'm going to refer to those as EPPs for short. According to the law, there are essentially 2 ways to seek initial EPP authorization. One route would be that the program can apply through the process that we have established through the state. And the second is that a program or an entity that's already under national accreditation through the Council of Accreditation of Educator Preparation, or CAPE, if they have CAPE accreditation, that is sort of a fast route for them to come to the board for consideration. So in this first application proposal, Moreland University is seeking initial authorization through the national CAPE accreditation route. This is an online program. It offers a 9-month online program and has a presence in a number of other states across the country. As I mentioned earlier, they are a CAPE accredited. The program is aligned with the International Society for Technology and Education standards, as well as the NTASC standards, as the Interstate Teacher Assessment and Support Consortium standards. And they've also incorporated the science of reading throughout their curriculum. So all of those things are in place throughout their process. In your materials for this discussion item, we've provided for you the Moreland National Accreditation documentation. That's the CAPE accreditation information. I also put in there a PowerPoint developed by Moreland University that walks through a variety of the information and PowerPoints or data points related to their program and some of their outcomes. And then thirdly, we've provided a copy of their course catalog for you. And given the national accreditation award to this organization, we recommend that the board approve Moreland University for initial EPP authorization in the license areas that are listed on the last slide.
Any questions?
Are there any other online programs that are approved?
Entirely online programs? Yes, we do have a couple that are present. Teachers of Tomorrow is one. There is a cooperative program, a joint program with the support of UNC Chapel Hill as well as NC State that I think it's called Pathways. That's an all-online program as well. So there are some other all-online programs that are present. Yes.
Yes. Is it educational question, school me here. If they have the CAPE,
Mhm.
what's the benefit of giving them EPP approval here?
Right. So what we're trying to do here is authorize an entity. In this case, it's an outside of North Carolina entity to be allowed to be essentially to play ball in North Carolina, the state of North Carolina. To recommend licensure, right. If they didn't do that, then they would have to, a candidate that would be graduating from their organization would have to come in as an out-of-state candidate. And so this would give them in-state routing. Mm-hmm. Great question.
Very good. And the next.
Yes, if you, this is in the same vein of educator preparation program authorization. I have a second one that's coming to you all for consideration. This second proposal is coming from the Knowledge is Power program, or KIP. Since they are not nationally accredited, they then have to go through the state board approved process for initial authorization. I'll walk you through some highlights on that in just a second, but just a quick update on KIP. KIP is a charter school network with 8 schools across the state and serves a predominantly economically disadvantaged student population. They've been in place here in the state since 2001. Their interest in starting the EPP is to recruit, retain, and develop certified teachers that are well prepared to teach in high needs and rural school settings that they serve. And this is not unlike what we've seen from some of the LEAs that have developed their own educator preparation programs. 2 that come to mind would be Winston-Salem and Charlotte Meck. So essentially what they're doing is they're saying, if we bring this in-house, we can largely recruit and really focus our efforts in the areas that are needed in our programs. So a quick refresher on the state authorization process. Applicants, if you go down this route, let's say you don't have national accreditation, you're going to go by the state process. Applicants must then present materials about their program proposal to meet North Carolina standards, as well as the CAPE national standards, which are listed on the slide in front of you, the areas that they're writing about and writing towards. And the law requires that the application and the supporting materials are then peer reviewed. And we now for the past year, a little bit more than a year, have been using CAPE national reviewers to conduct that peer review process. As opposed to just folks within North Carolina. That avoids any potential conflict of interest, as well as it brings a level of really high rigor to those peer review processes. It is of no additional cost to the applicant, and it's incorporated into the partnership the contract that we already have between the state and CAPE. annually. So that part is always done by CAPE going forward. And so the next thing I wanted to share with you is that the proposal, when it's coming to you all, what happens is essentially the peer review has been done, and on all those standards that were listed there, the CAPE reviewers have found this application to be either ready or developing on all the standards based on that peer review. And I say developing because in some cases these are programs that don't have any data yet, so they can't pull from maybe another state that they might be working from. So that's why there's this allowance for ready or developing. But if they have any categories that are not developing, we hand it back to them so that they can process improve until it meets a level of rigor to bring it to you all. So in your board agenda materials then, there's a whole host of materials that have come in from that application process. We can certainly provide all of them for you, but we've narrowed it down to a copy of the narrative application that sort of narratively describes how they're addressing each of the standards. There's also an overview of the program curriculum by each of the 3 licensure areas that they're seeking to offer. There's a copy of their assessment system and its alignment with the North Carolina Professional Teaching Standards, and a copy of their CAPE peer review. So in the case of KIPP's application, the proposal, as I mentioned, has been peer reviewed and found to meet all these standards. And so we're recommending to you all, the board, to approve KIPP for initial EPP authorization to offer a residency pathway in 3 areas, K-6 elementary, middle grades math, and middle grades language arts licensure areas.
Very good. I read somewhere, I know with KIPP, I'm not sure about the other, but I would imagine this is applicable to the first EPP. The EdTPA is applicable. Candidates do have to go through elementary, yeah.
That's correct. So they would be under, I think, let me flesh out what I think you're asking just to make sure that I'm responding to it. So if we have this out-of-state program that might be trying to produce teachers in North Carolina, though the outcomes of those programs have to meet all the standards and expectations of North Carolina. So if there are specific tests, like content or pedagogy tests that are required within North Carolina, they have to meet those expectations just like any other candidate that would be coming out of a North Carolina approved program. They are also subject to the same outcome metrics and the public reporting that we do, and the scouring of all the different variables and content that programs have to adhere to when they are authorized EPPs.
So their data would appear on in the dashboard?
In the dashboard, although I will say there's a bit of a latency effect there, because if you think about it, they would get approved, and then the point at which they approve, they would have a cohort. That cohort takes a while to get to the other side. So it might take a year or 2 for us to have outcome data. But yes, as soon as there's a cohort, we would be posting that just like any other program.
A question. 2 quick ones.
Sure.
So this is like KIPP, the national KIPP.
In this case, this is KIPP, the North Carolina KIPP. Although you are correct, they are a subset of KIPP, the broader entity that is operating across the entire country.
Is
Yes.
their program designed to only seek certification for teachers in KIPP schools or all teachers in high needs schools?
Great question. So what they're trying to do is this seeking of initial authorization is that the outcome of that product would be a teacher that would be certified as a licensed teacher to operate in any public or charter school across North Carolina. So yes, and because it's KIPP, you can imagine that some of their curriculum is going to be really honing in on those specific areas of urgency that are related to their specific schools. But yes, as a totality of what they're offering, they're trying to produce a teacher that's going to be really effective for any public or charter school in North Carolina.
So I guess the finer point in the question is their application process for those who are interested in seeking certification through KIPP will be open to all.
That is correct. That is correct. So I could in theory apply for the KIPP program, and the resultant outcome of that is a license, and I could choose not to pursue working with KIPP. I could go with that license and work anywhere else if I wanted to work anywhere else.
That's another question then. So but can I access the KIP program?
You could
Yes.
still do that, yes. Mhm. Yes.
In looking at the titles of courses for KIP, my only concern, and perhaps this is in some other document, is that I don't get a sense of enough focus on teaching reading. The course titles, and I know I read that somewhere along the way, the science of reading is built into, somewhere in the curriculum, but it's just not standing out.
I can certainly bring that to their attention
If you would.
and bring some more materials back to you for next month for
Just
consideration.
can't tell anything from the titles of the courses appear to be themes,
Mhm.
not course titles.
Okay,
So if additional information around the reading would be helpful.
sure. I'd be happy to see if we can get that from them.
Other questions, Vice Chair?
Just one, just for background for all of us, at this point, we've approved several already, obviously.
Yes, sir.
And as I understand it, this school does not yet exist, that is, it's not in operation, but one of the things it's trying to do is to get this certification to be in operation.
In the case of KIP, yes. In the case of Moreland, no.
Yeah.
They're operating in other states.
How many have we approved where the school is not yet in operation?
Oh, there have been a couple. There have been a couple. I'd have to. I mean, I can certainly bring that number back to you officially. But when I think about any LEA program, for example, this board just approved Winston-Salem recently, within a couple of months. That's a program that did not exist prior. Just as a quick example.
And that's one I could think of, but I was hard pressed after that.
The community colleges would be starting from scratch, and we've been rolling them out over the past year or so. And then I think there might be one or two others. So it's not unprecedented, but I wouldn't say that it's a frequent occurrence. Generally, I'm bringing about 2 or 3 of these applications a year to you all. Since the law opened up the possibility of alternative programs to operate in North Carolina. It's been a couple years.
Thank you.
Mm-hmm.
Seems like what is in order, Andrew, is in the near future is a report back to the state board on these EPPs that we've passed approved, and maybe a status report on them.
Okay. Yeah, in addition, I would, certainly all of the data of approved programs that are not, as I mentioned earlier, really recently approved. Any program that has a cohort out, all of those data points are on the NCDPI website, and that's a part of the annual report that we produce for external facing consumption. So you absolutely have access to all of that already, and we can certainly look towards coming up with some data for you.
Sounds great. If no other questions, comments, this item is going to be returned, both items are going to be, 3 items will be coming back next month for approval. Thank you very much. And that concludes the S&P.
Thank you, Dr. Oxendine. We'll move to the final committee of the day, Business Operations, led by Vice Chair Alan Duncan. Vice Chair Duncan.
Thank you. Along with John Blackburn, we lead the Business Operations Committee, and we have several itums today. First item is BizOp 1, and action on first read. We have 4 contracts. The first one is with Sedgwick, third-party administrator for workers' compensation claims and management. Eileen Townsend is here on this. We have, to help short-circuit this, we recently approved a contract for the coming year with the thought that we would go through a bidding process for the years thereafter. The timing is not going to work to be able to be completed a bidding process, and so we're now looking ahead to the next year, and Eileen has negotiated, or Ms. Townsend has negotiated for that, and I think can give us a quick report at this point on where we are.
Happy New Year, everybody.
Thank you.
Yes, 6 months ago, I asked the board to approve the $3.6 million fee for third-party administrative services under Amendment 6 for the contract period of 7/1/2023 to June 30th, 2024. Fast forwarding 6 months now, I'm requesting the board to approve Amendment number 7. This will take us into the contract year, July 1, 2024 through June 30, 2025, and the fees are $3,780,000. I remind you that the third-party administrator handles all of the workers' comp claims for DPI. By that I mean they handle the administration of the claims, the intake of the claim. They also pay the benefits for all claims under medical and lost time, and these claims are those that are filed by the injured workers. We have about 6,000 to 8,000 new claims a year that come in, and we have about 1,500 open claims. Just to give you an idea of the magnitude of these costs, in fiscal year 2023, the amount was $64.8 million that we spent in benefits. $51 million of that were state spent dollars, and $13.6 million were local. When we decided that perhaps we needed to extend this contract again through 7/1/24 through 2025, the initial quote that I got was $3,869,433. That's about a 7.5% increase over the 3.6. We did go back and forth to negotiate. And now today, as I said, I'm here to ask you to approve the $3,780,000 for Amendment 7 for another year. Again, 6 months ago, I asked you to approve this contract under Amendment 6. I told you at that time that there was an RFP that was going out. It did go out, but it went through state P&C, and they did come back, and they returned it, saying that perhaps this RFP was more suited as an IT contract. So, I know, right? So we have been going back and forth now for 6 months, and I do think that we are in a good space now, and we are going to be okay. We are going to be able to get this through as a non-IT procurement. I have put in the RFP the cyber risk requirements, the contractual liability requirements, the continuing business interruption, and the SOC 2. So I really think we're in a good space now, and hopefully we will get this through, but we do have to yet again, I'm asking you to approve the approval of the 7/1/24 through 6/30/2025, so we can get it out properly, the RFP, and we can award it in the proper manner. That's all I have. If there's any questions, I'm happy to answer them.
Thank you. So rather than going forward with the bid process, we're having to do an extension at a greater cost for an additional year than what the one we have for this year is. And hopefully, we will get to the place soon where we can move forward with the bidding process and not go through the DIT process to have to do that. Since I think I noticed a number of expressions around the table, this is not an IT type project.
No, not at all.
So, are any other questions on this? All right, thank you very much.
You're welcome.
Appreciate your work on this. Our second contract is for homeless and foster care education with SERV at UNCG. This is an important contract to the department and to the state, which is for the benefit of our homeless and foster care students, and have Alex Charles here as speaking on this item, and welcome.
Good afternoon. So before you find a contract of just shy of $785,000. This contract is to support our students who are experiencing homelessness. So under the Elementary and Secondary Schools Act of 1965, as amended by the Every Student Succeeds Act of 2015, it outlines to our schools of how we're going to support our most vulnerable populations, of which are our students who are experiencing homelessness. This contract is to contract with the UNCG Serve Center, who also serves as the National Homeless Center. So that's a very unique resource that we get the privilege of partnering with. With that, with the two laws I just mentioned, as well as the McKinney-Vento Act, they sort of work in conjunction with each other. And with that, the UNCG Serve Center will be administering these funds, monitoring these funds, collecting data, reporting data, providing resources, technical assistance to our PSUs, as well as to provide that quality students and supports to our students who are experiencing homelessness. This has been a long-time contract we've had with the UNCG Serve Center. We've had many of these, and so we want to continue that support for the students of North Carolina for the 2024 year. Any questions?
Any questions or comments, this is a long-standing contract, but a very important one. There's a lot of important work done for students who have a lot of challenges in life under this contract, so we appreciate it. Dr. Oxendine.
Thank you very much. So you mentioned something about the Vento, the federal
Mhm.
grant. So how, explain to me a little bit more about how they work in conjunction, or do they?
So the main funding that supports strictly homeless students does come from the McKinney-Vento Act. We do get that within North Carolina. It is administered out as sub-grants to the PSUs across the state. The Service Center sort of administers those funds, helps provide that. But when you're looking at the bigger picture, we're also serving them through Title I funds and through all of our other title areas that we have. So we sort of work in conjunction with, so the Office of Federal Programs as well as the UNC Jersey Service Center are working together to support our students who are experiencing homelessness.
Okay, thank you.
All right, thank you
Thank
very
you.
much. Our third contract is Battelle for Kids, Scope, Phase 3, related to the Portrait of a Graduate. This is a contract that has already been awarded, but this is a further amendment to it for a amount that's much less than $500,000, but the total of the contract is more. So Christy Van Auken is here to explain this briefly for us.
Good afternoon, board members. So just very quickly, this is an amendment to the contract with Battelle for Kids to help facilitate an on-site and in-person design lab for teachers to help us design performance tasks that would be implemented in in classrooms rather, that align the standards, the North Carolina standards, and then also the rubrics that have been created for the Portrait of a Graduate, and also the competencies and the durable skills that are assigned in the Portrait of a Graduate. So that's going to increase the contract amount by $48,500, and we would ask you to approve that amendment today. Thank you.
Thank you. Any questions or comments? Yes.
So I want to make sure that I think I heard it correctly, what you were saying. The additional 48,000 is not for the 16 assessments, but for Battelle to increase their services to support how teachers will come together to develop, or others will come, the design team will come together to develop those 16 assessments.
That is exactly right. So the result will be the 16, probably even more than that, assessments and design tasks, and then the testing in the classrooms, piloting in the classrooms and coming back, and then having that really cool deck of assessments that then would be available to all teachers across the state.
And at some time, not today, I'd love to know more about the thought process behind additional assessments that we're providing to schools as a support to help with how the implementation of Portrait of a Graduate or the monitoring of the success of the Portrait of a Graduate is going, because they are additional assessments.
So it's really an activity. So the assessments are not like a physical test that a student has to take. It's an activity more like a capstone. It's very interactive. It's designed that way to be experiential, but it does include the standards in North Carolina, standard course of study, the rubrics, and of course the durable skills. So honestly, a lot of this, Ms. Moore, is also being done already in our classrooms. We're just providing more materials and resources for those teachers.
That's very helpful. Thank you.
Wonderful.
Dr.
Thank you.
Oxendine?
Just to piggyback on that, that has been my concern all along, because when I hear rubrics and assessment, I go back to my days teaching, and I think, where do I get it in the 6 and 7 hour day? So you're saying it happens kind of organically?
That's absolutely right. So I think the idea of this is to not add more, like to be another new thing, but really to be the thing that is integrated into classroom instruction in a very intuitive way. It's not really supposed to be something that is plussing up the teachers. It's really just a new way to think about identifying for students and for teachers, so the students themselves to be able to identify that they are developing and growing in these durable skills, and for the teachers to be able to identify that and to encourage students as well. Superintendent,
Superintendent.
Thanks. So I totally understand the concern that we're adding to, but the way that I think about this is you know, let's say 60% of teachers are actively doing this already, but 40% are not. And maybe that's because they're new and they don't have these kinds of things in their toolkit yet. Whatever the reason, all kids need to be experiencing this. And so if I'm a teacher who is not doing this and I just don't have the time or the bandwidth to think about how I'm gonna integrate these things, it's being handed to me on a silver platter now. And I don't have to spend the time and the effort putting it together. It is shovel ready for me.
So, would a rubric be required for each child, each student?
Well, nothing
how is
about
this
this,
done?
yeah, nothing about this is required.
That's
This is still all up to, now, it could be that Principal Green decides as part of our school improvement plan, we're all going to do this and therefore the teacher must use it. But neither I nor the state board nor the legislature has said thou shalt do this. So, if a teacher decides they want to use this, then having a rubric eases the grading challenge of the time constraints that come along with grading.
And I should mention too that we have partnered with teachers throughout the state and administrators throughout the state in the creation of all of these resources. So this is not DPI experts that are doing it, it's really teachers helping teachers.
All right, thank you.
You're welcome. Thank you.
Any other questions or comments? Not hearing any, let's go to our fourth and last contract. This is for Governor Moorhead School in Eastern North Carolina School for the Deaf, a transportation bid. Melvin Diggs is gonna present this to us. This is for a significant amount of money, but it's important to note that it's a 5-year contract. Part of it's for local transportation. These obviously are schools that have a very wide geographic area, so some of it's for the longer transportation that takes place for our students. Mr. Diggs, welcome.
Thank you. Good afternoon, Superintendent, Board Chairs, Chair members. Appreciate the opportunity to come before you and just asking that you approve this contract today. We've worked hard to provide this 4 or 5-year term. Certainly we have a catchment area that is across the state, and we serve students far and wide that are visually impaired, have IEPs. This transportation includes specific information and specific accommodations for students to make sure that they are accommodated well and can travel safely. And the goal is to improve overall transportation times and get kids to be at school as much as possible. So again, I just ask your encouragement and encourage you to complete the approval of this contract. Any questions?
I think one last important thing to note is it did go through a bidding process.
It did.
Any questions or comments on this? All right, thank you very much for your work on it. It's important for our
Thank you.
students
Thank
that
you.
we have that in place. All right, we move to BizOp 2, our second action on first reading item, and ask Susan Brigman to share with us the 21st Century Competitive Summer Enhancement Grant Program recommendations for funding.
Good afternoon and Happy New Year.
Happy New Year.
I'm excited to be here today to share with you our recommendations for funding for the Bipartisan Safer Communities Act 21st Century Community Learning Centers Competitive Summer Enhancement Grant Program. And I say that fast. So, as I stated back in the fall when I came to you with the RFP, June 25th, 2022, President Biden signed into law the Bipartisan Safer Communities Act, which included additional funding for 21st Century. And North Carolina was awarded approximately $1.4 million for us to run this particular summer enhancement grant program. This competition was only open to organizations who were currently receiving 21st Century funds. So currently we have a cohort 15 and cohort 16, and so they were able to submit applications if they chose to do so. The purpose of this grant is to foster safer, more inclusive school environments, as well as support evidence-based practices intended to increase attendance and engagement of students, especially those in middle grades and high school. For this particular iteration of the grant, we proposed summer intensive programs, so they were only going to be 2 to 3 weeks in duration, and there were several different focus areas in which grantees could choose to focus. One would be a kindergarten transition program if you were a PSU, 5th to 6th grade transitions, 8th to 9th grade transitions, or intensive tutoring or credit recovery programs, or if you chose, you could do some type of summer intensive program to help with mental health supports. Applicants could apply for funds from $25,000 up to $150,000 based on the needs that they identified, of course, the scope of the program, the number of students they were going to serve, and the program design. And it's also important to note that the organizations are going to be able to request reimbursement for expenses beginning March 1st, 2024 and through September 2nd, 2024, because we do know that in the spring they will need some funds to prepare for summer programming. For this grant, we did give absolute priority, as we do with all 21st Century grants, to programs that we're proposing to serve students in Title I eligible schools. We also had some competitive priority points for CSI, TSI schools, joint application submissions, some school environment factors, and mental health. It's important just to remind you that there was not priority consideration given based on the region the programs we're proposing to serve, because these were all current grantees, and that consideration had already been given when they applied for their standard grant. So let's look at the results. So we did receive 11 applications from 7 State Board of Education regions. There were no applications received from Region 7. And the next slide, the applications that were received and reviewed are listed in that table. And so you can see the region and the county in which they were proposing to serve. 9 applications across 6 of the regions met the minimum quality band. So 9 applications are being recommended for funding for a proposed total award amount of $8,039,557, and the applicants recommended for funding are listed in the next table on the next slide. And so you'll be able to see how much funding that they are going to receive, and then you'll see the total at the bottom. The 9 applicants recommended for funding proposed to serve 625 students for 2 to 3 weeks of intensive summer sessions, and the summary profile of the number of applicants by program focus type is on the next slide. And so there you'll be able to see how many of them are going to propose to do a 5th to 6th grade transition, 8th to 9th, intensive tutoring, mental health, and unfortunately we did not have any PSUs apply to do a kindergarten transition program. But of the 11 applicants that submitted a proposal, 2 were charter schools, 8 were community-based nonprofits, and 1 was a community-based for-profit. So no traditional PSUs submitted for this particular competition, and there was 1 application that was uploaded into CCIP that was not able to be open and viewed for review, so it was not able to be scored, and then there was also another application that did score in the unacceptable quality band. And so those 2 applications that are not recommended for funding are listed on the next table. Just to give you an idea of where we are with the remaining part of this competition, we will be doing onboarding webinars for any of the grantees that will be receiving these funds. We are scheduling those for late January or the first week of February. CCIP will open up again February 16th for the sub-grantees to upload any required documents that they still need to submit for us, and they'll also have to submit a final budget for approval. And all of those documents and their budget will need to be in CCIP by March the 15th. Do you have any questions?
Questions or comments? John, I was expecting one from you for sure.
Decided to be quiet.
All right.
Not from my region.
Oh,
Very good. Thank you all.
thank you.
Our next item is BizOp 3, report to the General Assembly. This is a school connectivity initiative report presented annually. Matthew Mayo, our Director of Digital Teaching and Learning and School Connectivity, is here to report on this, and there's some good pieces of news to report.
Absolutely. Good afternoon, everybody, and Happy New Year to you. We're excited to bring to you today the annual update for the School Connectivity Initiative. Co-presenting with me today is Ray Zeiss, the Senior Director at the Friday Institute. Just to give you a little bit of background information, the School Connectivity Initiative began in 2006, provides reliable and sufficient fiber to every PSU, Wi-Fi to every classroom across the state, including firewall, content filtering, single sign-on identity management, along with network engineering and training and consultation services to all of our PSUs. The School Connectivity Initiative program utilizes the federal E-rate program, which is administered by the Federal Commissions program. And the PSUs receive discounts for internet services and networking equipment based on the National School Lunch Program participation. Currently, the statewide average discount is a nice 74%. So for every dollar in state funding currently for the year 2023, E-rate eligible goods, the services delivered about a $2.46 value in return back to the PSUs. For 2023, we had several milestones and accomplishments to be able to celebrate. One of those big milestones was we finally reached $2 billion in procurement since the inception of the School Connectivity Initiative at no cost to our PSUs, with $1.5 billion coming out of that $2 billion straight from the E-rate filings that have been done across the state. We have been able to deploy managed endpoint protection services on over 200,000 critical servers and employee devices at no cost to the PSUs. We migrated hundreds of critical servers for our PSUs to more advanced firewall infrastructure, again, at no cost to the PSUs. We were able to deploy asset discovery and enumeration tool for all of our PSUs at no cost to the PSUs as well. And in order to be as strategic as possible, we continue to ensure that the most effective usage, monitoring, consumption is a very critical component of our success in this initiative. And this has really made North Carolina a national leader and one of the most effective users of the federal E-rate program at hand. Through our partnership with the Friday Institute and the awesome leadership of Ray Zeiss and many tools that have been developed help us support this and continue to make us the leader across the nation. I cannot say enough how grateful we are to have Ray and his staff partner with us here at DPI, and the expertise and the value that they bring not only to us here at DPI, but to every PSU across this state. It is my pleasure to transition to Ray, as you'll learn more about information on usage, demand, equal access, and final recommendations.
Thank you. Thank you, everyone. I'm Ray Zeiss. It's hard to believe this is my 10th year working on school connectivity, and it is a joy, and it's an amazing program. I'm always excited to talk about our successes here in North Carolina. Just as a quick reminder, we have consolidated internet access through North Carolina Research and Education Network, which is managed by MCNC, and the folks out at MCNC do an amazing job helping the districts and connecting everyone. We do competitively bid internet connections or fiber connections from the schools to NCREN, and we do competitively bid at the state level at DPI contracts for Wi-Fi in every classroom. All of those items are E-rate eligible, and we help the districts through the team here at DPI to apply for E-rate and get the most E-rate dollars possible. And we really have that tuned in. If we can go to the next slide real quick, our capacity at NCREN, so what we're buying from public internet access is about 550 gigabits. That's a half a terabit. A terabit is 1 million megabits. It's big numbers when you get to the scale that we're at now. And as you can see, the rebound back from COVID, we've accelerated the amount of data we're using in schools. We continue to keep up. Prices have remained pretty stable despite the massive growth in capacity and usage in the internet connection. I'll go to the next slide. We've done a lot of analysis. There's a link in the bottom right-hand corner, go.ncsu.edu /SCI report, School Connectivity Initiative report, where you can dig into the data, add filters, look at districts, regions, sizes of schools to see how much basically funding per student, funding per megabit, every which way you want to slice the data. This particular graph I like because on the x-axis we have percentage of kids on free and reduced lunch in a district, and y-axis is internet usage per student. So normalized across that, we find no correlation between internet quality and the amount of kids that are on free lunch in a district, which is the #1 indicator for the E-rate discount rate. So what I like about this chart is it shows no correlation. I mean, there is a trend line, but there's no correlation there. In the next slide, we show the actual dollar amounts for Wi-Fi. This is just Wi-Fi, not internet. And again, I just wanted to show based on the discount rate, which is based on rurality and number of students on free lunch, that we have spread the E-rate dollars fairly evenly across those groups. And then one more important picture, which is the 9-year history of this is just Wi-Fi, the reason I wanted to show this is because there's a big question about reversion of funds, and I know that's a big thing in the state, but there's no easy way to predict how much money is going to get spent on Wi-Fi. The red line is the total contract value over the last 9 years. The green line and the yellow line, they always will match, hopefully. Yellow is how much we requested from the FCC. Green is what the FCC paid, and the state funds pay the difference there. So as you can see, that difference between the red line and the yellow line changes every year. It's never a constant rate. And we have that variability because we have a ton of flexibility for the districts to pick when they want to upgrade their Wi-Fi. And there's FCC rules that are strict about, you can't throw devices away before 5 years and things like that. So there's a lot of guardrails in place to make sure the funds are spent effectively. And since we have state contracts for all this, we have amazing discounts at the state level for this equipment because of the economies of scale we have. And so the program is really in basically an autopilot mode, except for the variance in the year to year. And the current fiscal year we're in right now is the biggest year we've ever seen in Wi-Fi. And that's probably because coming back from COVID, there was so many other things to worry about, laptops and things. There was probably a little less demand on Wi-Fi in 2021 and 2022. This year, it's huge. I think it's $69 million total. So the state will pay the 25% of that portion. Real quick, I'll go to the next chart, which is just the financials, and to note that there are some things that are not E-rate eligible, mainly around cybersecurity, identity and access management, client network engineering, firewalls, endpoint security, which is not on this chart because it didn't technically come out of school connectivity funds. But all those programs are in place right now, and that's actually one of our recommendations. So on the final slide is just to point out that most of the cybersecurity things we've done is with one-time COVID funding that will expire, and it's important that we not lose the momentum we have on cybersecurity. And we've been to several national conferences, and every state is jealous about what we've been able to accomplish on cybersecurity in our state. And I feel very confident that I'm not going to say we're completely safe, but I will say that we're in much better shape than a lot of other states that don't have the centralized push to accomplish this. So that's my final slide. If anybody has any questions, I'm happy to.
Any questions
Yes.
for Ray? Let me just say thank you for the long collaboration you've had with the department and the great work you've done, as is illustrated by the $2 billion mark being reached this year, and you've been very much a part of the entirety of that process. So we do want to express appreciation to all the work and contributions you made over a long period of time. Are there questions or comments on this? This is a good news report.
Well, thank you. Because you're standing here, I just have to remind everyone in the room that North Carolina was the first state in 2018 to connect all K-12 public learning spaces to robust Wi-Fi in the country. And that is largely because of the work that you did at the Friday Institute with the State Board of Education, Lieutenant Governor's Office, as well as multiple administrations going back 15 years. So thank you.
Yeah, I had a very small part. I might have written the RFP, but there was a lot of people that have collaborated over the years. Many of them here at DPI, many have moved on, and at MCNC, and I appraight them all. Thank you for your time.
Thank you.
That was not a might have. He did write the RFP. All right, thank you very much. All right, we move on then to our next item, which is FISOP 4, which is the State Board policy amendments for allotment policy on a number of different changes for several different allotments. Alexis, welcome. Nice to see you.
Welcome.
Michelle.
Thank you. Good afternoon. Today I bring kind of the final batch of allotment policy changes related to the recently passed budget. This group, if you recall, the last couple have been released kind of more adjusting and modifying current policies and some new, more formula grants. This batch are grants, competitive grants, most of them in nature. So in your materials, you will find that there are pages from the allotment policy. These are new. You'll see they're all new program report codes, PRCs as we refer to them, and they are all underlined to show that they are all new. So going through at the beginning, we have the PRC 251, Economically Disadvantaged Public School Support Funds. This is not related to the disadvantaged student supplemental funding. This actually is, it's a $4 million, it is formula, and it goes to local education agencies, charter schools, not lab schools are not mentioned in here, that have a high economically disadvantaged student population, and they have exceeded growth in the prior year. And the policy does explain what they are permitted by law to use those funds for. The second item is the Extended Learning and Integrated Student Support Grant. This is ELLIS, known as ELLIS. You will recall last month, Susan Brigman presented to you the application process for that. This is the authority of distribution of funds related to those grants that go to nonprofits. This, if you recall, it was $7 million of state funds. These are all state funds unless I do mention otherwise. So the third item is the Health Career Promotion Grant. This actually was a one-liner in the committee report for $1 million. It is to support public school units in promoting health careers for their high school students and their parents. So there is additional language here that was not provided in law to kind of put some parameters around this grant. The statements here, as you'll see, is that grant recipients will receive a pro-rata share. It shall not exceed $25,000. This total grant is $1 million, so it will not go to every, is not able to go to every public school unit. It will be based on the average daily membership of the PSU, and that there will be, if there is more applications than money available, then the priority will go to public school units that have a workforce demand that they can show through an occupational outlook data. So in other words, if you have an area that has a higher need, then they will receive priority. The next grant is a STEM, Increasing Engagement in STEM grant. This item, it is for $1 million again. It actually is the grantees are determined by our state superintendent, so this is providing authorization for the distribution of funds. The legislation is fairly prescriptive as to how to determine and categorize the PSUs that receive those funds. The middle school reading, PRC 257, this is a kind of an extension on the ESSA funding. This program was initially funded out of ESSA, and now this is state funds to continue those. In the legislation, it does, in continuing that grant, it does identify specific public school units that are eligible for that grant. PRC 258 is Plasma Games. This is another ESSA extension, so the language is similar to the ESSA grant. However, there are specific items in the formula that have been put there to ensure that the grant can go to as many public school units as possible within the funds available. And so the awards will not exceed $60 per 10th grade ADM. The grant can be used on students outside of 10th grade, but this is just the funding factor that we are recommending within the PRC. There is priority to specific PSUs that received the funds through ESSA, as long as they are utilizing at least 80% of the license grants. in the legislation, it stated that they had to be actively utilizing the licenses they have. This recommended language of 80% of the license grants as of October 1 is a recommendation to make that a little bit more defined. The Stop Arm Enhancement Fund, these are for, as they state, stop arms for the school buses. And they are, all LEA or public school units are eligible for this, for these funds. This also is determined through the law by the grantees, by the state superintendent. So again, this is providing the guidance of the authorization for the distribution of the funds. And the final, actually not the final, almost the final, the PRC 252 is a teacher apprentice grant program. Again, this is $1 million, and it is to provide funding to the LEAs, only LEAs, through a competitive grant process to provide up to $4,600 per academic semester for teacher apprentices for tuition to get their license, and also salary supplements for those teacher apprentices who become a licensed teacher and accepts employment in the LEA. And now for our final one, which I did sneak in here. This is for federal. It is a federal grant. However, the grant is actually administered through the Department of Public Instruction. It is the Rethink Education Stipends. The Rethink grant provides professional development for teachers in this area. And this PRC is set up to send funding to the school districts to compensate those teachers for that professional development that they attended and completed. So that actually, as I said, that Rethink Education grant is already in motion and very active. And with that, Mr. Duncan, we are complete with our allotment policies, hopefully for this year.
Well, we'll see. I'm not sure that's the first time that's been said. Any questions or comments, Dr. Oxendine?
Yes, I do. The PRC 252, the teacher apprentice program.
Yes.
That's an interesting one. So, has the RFP, it hasn't gone out. I mean, has an RFP been released on that?
I do not believe so.
No.
No, it has not.
So
Thank
that
you.
comes through Dr.
Yes, so each one of these, with the exception, I'm sorry, I didn't mean to interrupt.
It's okay.
So each one of these has a program administrator within the department, with the exception of a couple. This program is administered by Dr. Tomberlin's area, and based on his nod there, the applications have not gone out.
Thank you very much. One other additional question with that PRC 252. The 46, the salary supplement that comes with that, along with the 46 per semester, and the salary supplement would be in addition to what a county would award. Is that correct?
In addition to what?
A county supplement?
So these, yes, so this is, I believe, during the time of the apprentice. It's not the local salary supplement that is provided. It is in addition to, yes.
Very good.
Yeah.
Thank you.
So, yes.
Just a quick question about the Plasma Games program. Did you say that this is continuation funding for either schools or districts that have already been working with Plasma and the software that they have?
So the way the legislation is written is, well, we had the ESSA, right? We had the ESSA grant funding through ARPA. Some of that funding was for Plasma Games, to contract with Plasma Games. And there were districts that were identified. And so with this state funding, it prioritizes those same school districts. It does not exclude other districts, but it does prioritize the funding on those.
And is it the district that has the burden of ensuring that the educational software meets all of the safety sort of standards that are necessary for using software? Is that done from DPI?
That I would have to confer with my experts.
Can we ask Vanessa? It's okay. It's hard to hear. With regards to Plasma Games, could you come to the podium? With regards to Plasma Games, which had already been funded using some ESSER dollars, and now, of course, there was money appropriated that allows districts that have already been using those licenses to have priority in a new grant cycle with state dollars. Who is responsible for making sure that all of the security protocols are in place? Is the burden on the district or is it on the department?
Now that they are connecting directly with districts and not going through DPI, that burden is now on the districts. We have authority, if they are connecting to one of our state systems, to make sure that all the security protocols are in place. However, we have recently put out, this past May, some guidelines for our districts to follow. And they are just that. They are guidelines that we highly recommend, very specific, that they look at and look through with any of their vendors with any sensitive student data. It created quite a hullabaloo because it's a lot of work. But it is the work that we do here at the agency before we let any vendor have access to our data. So when we worked with Plasma Games initially, we ran them through the processes we do with any vendor that receives student data that's protected.
Thank you.
Yeah.
I just felt it important to ask that question because I assumed it would move down to the districts, and they may not all have the same sort of background, so I think the guidelines will be very helpful.
Thank you.
So a couple of questions that have come from board is on middle school reading and Plasma Games, actually. Both those were originally from ESSER funding and designated by the legislature. Middle school reading has not been widely accepted and has not been used, as I understand it, in full. And I believe the department itself has concerns about what middle school reading is providing that's inconsistent with other very important initiatives we have in the literacy area. I think, Superintendent, if I said that right about that program.
Yes, and actually, once the I can't remember if Dr. Ryan is still here or not. Once the policy for the Office of Early Learning and the curriculum materials is in full swing, and it's the law that districts must be using curricular materials that are aligned to the science of reading, should a district use this vendor, they would be breaking the law.
And my understanding was that was even going to be reconsidered by the legislature in this short session potentially.
Correct.
So just, that's one of the issues here that's arisen, but it's, certain districts have been designated, but many of those have said they do not want to use it. So for reasons related to what the superintendent's already touched upon. Plasma Games similarly was not fully utilized with the ESSER funds. There was again, there was a lot of money left that was available that was not used. And my understanding, and let's correct me if I'm wrong, is that remains the case with this additional funding, that there's not significant demand for the grants, if you will.
Well, these applications have not gone out formally. I think that the program people are aware that there will not be 100% application of those that are listed in the law.
Again, there's been a fair amount of public comment on these, but they are legislatively prescripted, and so we are doing what's legislatively prescripted. These were not, I do think it's important to say these were not state board initiatives or department initiatives, either one.
Correct.
So that's helpful information. Thank you for providing it.
Then a question about that 257 middle school reading. What happens to the funding, that 1.7? Does it just sit there or what?
We would like to use it for other things, but I don't believe that's the way it works. Ms. Yowski, perhaps.
Correct.
Superintendent may want to speak to it.
The funding is designated for that purpose, and if it were the case that there were not sufficient applications for it, then the funds would revert at the end of the year.
Which is a result that would make us sad, because I know there are a lot of initiatives that we very much would like to put that resource to. And I think the same may be true about the other item we discussed, so. Any other questions on these allocations? And thank you for walking through them, and I hope your prediction is right. This is the last one for the year. We'll see. All right, that then moves us to our action items. BizOp 5, this is an item we talked about last month, and we now have a report, and Carol Ann Hudgens and Jennifer Bennett are here to describe what it is that we will be moving forward with respect to this weighted funding for exceptional children students as of this month.
Yeah, again, Happy New Year, everybody. Jennifer Bennett, Senior Director of School Business with Carol and my partner in crime on this one. This is just as of this month. We do expect to have, I think, everything costed out in our final proposal in the February-March timeframe, depending on where we get with that. So I'll take you really quickly through the updates for you of where we're at. We've had a lot of very good information sessions across the state, met in detail just before the holiday, I think it was, after our last board meeting with the Sandhills RESA, with their superintendents, finance officers, EC directors, as well as other instructional people. I think there were about 80 people at that meeting to get a full breadth of feedback from them. So it has truly been a nice partnership, I think, across the state with this. In this update, I wanted to remind everybody of the current model. So the current model is at flat dollars per pupil. This year it's at $5,309.31. There is a cap on the head count, so it's at the maximum of the 13%. And so we just wanted to remind, and it's also based on the state funding is based on the April 1st head count, whereas federal funding is based on a December 1st head count. In our new model, we're proposing to align the two head counts to December 1st. That way it's very consistent with the ECATS data that people are using for their programs within their districts. It's consistent with the federal funding models. And just provides us a better solid framework for that. It's a bit of a funding in arrears, but I'll have more information in the final report, or my analysis on the changes between April and December are not that significant as people may think, and so I don't think the December head count is a big drawback on that, and it aligns with federal data stronger. Our proposal would remove the 13% any funding caps. We also want to establish a base in the state funding model by applying the Title VI-B federal funding methodology and using that as sort of a base to ground and allow the districts to have some semblance of a base where the minutia of what they have to do out in the school districts is covered within that. Supplies, materials, different escalating costs, and it would be grounded in that Title VI-B methodology. And then what we want to do is center on just a couple key elements for weighted factors: the environment, and we're going to be using the placement code that is entered into ECATS for that. And then that will lead us into the intensity of the services based on the courses study that is assigned to all its students. Those two elements seem to resonate very strongly out in the districts. They know that data. It's in their case management reports that they get out of ECATS. And so it's readily available data that they can tie all of this program formula back to and understand that with how they're setting up their programs. You can go to the next one. Again, the student numbers will be coming from ECATS. We are centered on the data that they can easily, we want to make sure that whatever data we're pulling from ECATS, the districts can easily replicate themselves. So by having that data readily available in their own case management report. Be very easy for them to tie any of this funding back to their initial data. Average salary data will be the same data that we'll be using that we published and the state uses now for all the state budget build. That's what we calculate actually this month as we get our December data. So it's readily available in the timeline that budgets are being prepared for the state. Again, the feedback from the group and our own thinking is that we definitely want to have some kind of base within the model that allows for all the different fluctuations. The original model was very complex in allowing different weights and factors for contracting, supplies, testing, and different things. So by simplifying it and having a base in the model, we feel that will help with the complexities as well as provide a nice platform from which the districts can grow depending on their data, and using that 6B as the base. Next slide. The key elements are the weighted factors, which would be your placement code, identifier, so items from homebound to resource, separate classroom settings, the various pre-K settings, all have a code that's in the ECATS data, and then that student is coupled with an intensity of service as identified by using the course of study from standard to extended to future course of study. And that helps develop us into where the intensity would lie. And then we'll be grouping those factors into 3 main service levels, a 1, 2, and a 3, with 3 being the most intensive services required. And that should simplify the groupings and would align with what we see out in the field as the way they set up the programs. Then we're considering the staffing as the biggest burden. And so we're looking at those staffing type ratios for the basic positions, teachers, related services, and then paraprofessionals. Right now, our proposed ratios would align with the classroom or class size ratios currently employed and that the districts are used to having to abide by. And right now, we're validating data, just so you know where we're at today. Today, we are validating data from the prior year and current year in the case management records and in the ECATS data, so we can determine the fair weighting based on that case management data related to these ratios and the number of staffing required. And so once we have that done, that will help inform a fair ratio, we hope, and a fair recommendation in our final data. The next slide. I want to just remind everybody, just to help clarify what is this and what it is not. What it is simply a different funding model that generates a pool of funds for the PSUs to serve their EC students. Currently, the funding model is a per pupil. It takes a head count times the dollars, and that's the pool of funding. This would just be a different way of taking that pool of resources and distributing it that's more aligned with the placement, environment, and intensity of services required rather than a flat dollar per pupil. It is not a reimbursement model. It's not meant to be a reimbursement model for actual expenses. It is not going to direct the PSU on how they have to design or use these funds. It is simply how we distribute the money. As with any of the allotment policies that we bring towards you, it's how we distribute the money across the state. It will not determine a specific student's required services. We're simply using the data already in the system to help inform the model. And we are not requiring the PSU to expend a specific amount on any of the students. We are not saying that because this headcount generated this amount of funding, that's not telling the LEA they have to use those funds just for those students. They still have full autonomy on their pool of money and how they construct their programs for their students. It is also not a model that's meant to transfer $1 per pupil for that student as they transfer here, there, and everywhere. So our next steps is today, the report is due to the General Assembly January 15th. Our report is as of today. We do not have the full model costed out nor a final recommendation. However, we are calculating those total costs. Hope to have that done within the next several weeks, and we'll also be getting feedback from the LEAs. We're comparing the current year model to our projections for next year as well, since we'll have the updated, and we'll actually be starting to build 24-25 budget starting in a couple weeks. So we'll be looking to compare to the future as well as this year. The financial impact by PSU, and with the state and every PSU's obligation to require the maintenance of effort, we'll be looking to consider all of those fluctuations by PSU to ensure that the state as a whole meets that effort, as well as each individual PSU would not be in danger of not meeting their maintenance of effort requirements with any change to the funding model. And so that is where we are at as of today. Hopeful that we should be able to, we are hopeful to try to get this to you in February, but depending on how much feedback or other things we may want to do, it may be March, but we are in the, it's a short session, so we have a little bit of time, but I do know the General Assembly is anxious to have our final recommendation as they look to building the budget. So we are trying to wrap this up within the next few weeks. So we're here both for any questions.
Jill. Ms. Camden, sorry.
Just to make sure I'm understanding this correctly, there's not a commitment yet from the General Assembly that they are going to fund, that this is gonna be approved, or is there? What?
There is no commitment from them. They want us to propose a funding model, and then if they choose, there would be additional legislation should they choose to adopt any kind of model.
But they have not asked to see this before, or have they? I mean, just
No, they've talked about, there's been several reports over the past 10 years to discuss this at length. There's been a subcommittee, several, I think, and so this is of very high interest right now.
Excellent.
It says highest level of interest as we've seen in probably 20 years.
Finally.
And may I,
Yes,
and it's of high interest from leadership with the legislature.
Great, because this has been talked about for a long, long time, so what a huge thing this will be.
So just real quick, you said the report was due January 15th? January 15th?
Yes, they wanted the model completely fleshed out in January 15th.
They know they're not getting that.
Correct.
Okay. Just making sure, thanks.
We have good communication with our compatriots over there, and so they know where we're at.
So a couple of questions. The highest ratio I saw looking at level 1, level 2, level 3, or excuse me, the lowest ratio was 1 to 8.
That's our normal class size ratio. I'll let Carol Ann speak to that for our
Well,
severe needs.
Let me just make an observation, and I'm happy for Dr. Hudgens to speak to it. I'm aware of classes that are 1 to 1, 1 to 2, 1 to 4, and if we don't have any levels that go to that area, the question that rattles around my head, having, wanting this to work, but also being worried about getting to the right sweet spot, whatever that might be, is how confident are we about our methods of measurement that we will actually support what the needs of these very special children are?
So in the level 3 funding band is not only the classrooms that have 1 to 8, but the placement codes that are for residential, homebound hospital, separate school, et cetera. And so while it may not mirror the exact ratio for the whole group of placement codes there, the idea is that it is a small enough ratio that combined with the base funding and the other funding that comes into the district, that it would meet the needs of those students who are very complex.
Okay. I appreciate that. I'm still worried.
Yes, sir.
Because I'm going to use an example that you will know, Gateway School in Greensboro. Basically, all those kids are 1 to 1. Every single student in the school. And it's not the only school like that in Guilford County. Guilford County is not the only county that has a school like that. So that's why I'm worried.
So Gateway School is a public separate school, but I'm not entirely certain that every student there is 1-to-1 teacher. There may be a higher rate of paraprofessionals there and a smaller class size, but I don't think, or I'm not aware that it's 1-to-1 entirely.
there is no student that doesn't have either a teacher or nurse or some other form of a paraprofessional, as you have described it, with them at all times.
That's correct.
Yes, I agree that's
Yeah.
correct. How are we accounting for that?
I would say we're trying to the best of our ability within what would be a fair distribution model across the entire state.
Well, in level 3, not only is the teacher to student ratio 1:8, but then the paraprofessional ratio is 2:8, and then the related services increases as well. So that it all scales up for that level 3. I don't know if we quite got you there
don't
yet.
have any- it's okay, you're doing a nice job explaining it. Coming from it, as a result of that, it's very helpful. We're being asked to receive this report for forwarding to the Joint Legislative Committee, so when you're asked to vote tomorrow, that's what we'll be voting on. Any other questions or comments on this? Yes?
So, just looking at the level 1, can you answer a question? This is for students who might just be getting like pull-out services, as EC students, is that correct?
That
For
is
the regular
correct.
setting?
Or they could be receiving services in the general ed classroom with push-in support.
Okay. I know of many students who are trying to stay in the regular ed classroom, but they need an extreme amount of support to be able to do that. I think that that is a result of more students being diagnosed with autism and ADHD over time. And I wonder if we should just add one more little dollar sign over to level 1, just one more, because I know students who get 4 or 5 different services, which is 4 or 5 different professionals that are helping them on a weekly basis, and they're trying to stay in the regular ed classroom. So just a wonder.
We have factors built in for related services for that. It's not just a teacher ratio, so it's teachers and related services for all the categories. Paraprofessionals kick in with 2 and up right now, and how it's costing out. Right now, between just 6B puts in about almost $360 million to the districts, and allocated funding, and the state is putting in almost $1.1 billion right now in funding. So we are also being cognizant of the total funding effort that's already out there, and how that needs to balance with what we see as being expended from all different funding sources. EC is supported through not just these 2 funding sources, it's supported throughout a district's budget, and so we're looking at all of that for the weights.
I also want to clarify that regular resource and separate is defined by the federal designation of time spent away from their regular peers, not necessarily a classroom setting. So a student that has the federal designation of resource could actually be spending more time in a general ed setting with those other supports. And if you notice, the model also includes the intensity being based on the diploma. And so for students who might be in general ed more but working toward an occupational course of study, or some variation based on their class load that year, whether they're participating in CTE for some pre-vocational skills, the model is intended to be reflective of students more intensely if they're working toward a certificate, because we know that that's where additional complexities come in, like the separate schools and so forth.
So a student designated as resource, but with that occupational degree is actually in a level 3, not necessarily a level 1. So you can't go by just the environment. You have to add in that intensity to get where they're actually would track as level 1, 2, or 3, because we do want to make sure that that intensity of service is provided.
Any other questions or comments? All right, well, we have the same dynamic duo up for Biz Op 6, which is a report to the North Carolina General Assembly about the study for students with extraordinary costs.
Thank you. This is a new report that we were given when the budget bill finalized on October the 3rd. What I presented to you in December was the information that we have at the current moment. The study has 10 different variables, and it is looking at public school unit placement options in private schools with programs approved to provide services for students with disabilities. So we would like to provide the report as it was presented in December. There have been no requests for changes. We would like to go ahead and provide that report to the General Assembly, and included in that report is our request to have more time to fully study all of the variables requested and come before the board in the fall with a more complete analysis of the study.
Questions or comments on this report? One quick question, have we figured out the number of students who are actually have been placed in private facilities?
So we've discussed our best and final, knowing that we have to look at the variables a little bit different and look at truly private placements. And what we're looking at is approximately 139 students at this time is our best and final information going into the study.
So 2 follow-ups, are any of those out of state?
I don't have that information for you. That is maintained locally.
Okay, and second follow-up, does there tend to be a clustering to certain specific private locations, or is it a large multiple number of private facilities?
I would offer that it is varied because it's all dependent on who has vacancy, and those are at a premium right now across the state. And to your out-of-state question, there is part of state law that we have to look inside of North Carolina first. And most of the out-of-state placements are involving placements to private residential treatment facilities. And there's another part of legislation that addresses how we fund students in those circumstances.
Thank you for that information. Any other questions or comments? Yes.
I just have a question. I assume that delaying the kind of more in-depth pieces that you want to look at for the fall will not impact our legislative request to change the funding model.
No, the model that we just discussed previously is a separate piece. This is extraordinary cost, and while we are looking for incentivizing private school options for our districts, that's not going to have an impact on that EC funding model overall.
Thank you.
Any other questions? All right, thank you very much. We now move to Biz Op 7, which is a discussion item, and Alexis Schaus returns for, I love the captioning of this item, which is DPI funding in arrears.
Thank you. Yeah, Alexis Schaus, the Chief Financial Officer. So this report and review is requested through the session law, section 7.20, but it is not a new topic. This topic has been discussed probably since 2016, and specifically back at the beginning of 2021, I did a presentation to the state board on kind of the struggles and challenges with our allotted ADM. So what are we talking about? We're really talking about what student numbers should we use to fund public schools. This isn't about the amount of funding, it's really about what funding we should use. And the legislation requires us to develop a model that is based on actual ADM of the prior year as opposed to projections that we currently do. It also directs us to address new charter schools that, needless to say, would not have a prior year average daily membership, and to propose technical adjustments to that funding model. You do have a draft report in your materials, and the draft report actually provides recommendations on those first 2 items I just spoke about. It does not talk about the fiscal impact by public school unit, nor the technical adjustments. We have we received the average daily membership numbers relatively recently and not in time to incorporate in this discussion item, but will be included when we bring it back for action next month. So although not all costs in education are variable in nature, almost all the funding in the State Public School Fund is driven by student counts. And so we refer to that as our allotted average daily membership, and it is the backbone of our budget, and it is also the backbone of how we distribute the funding between public school units, and whether that is the number of teachers they receive, capital projects, instructional support, etc. It is really driven off by that allotted average daily membership number. To understand what we are proposing, you have to take back and kind of have an overall understanding of what we currently do with regards to our budget as well as the allocations. So the budgeted allotted ADM is really the number that is ensuring that we have sufficient funding to fund the public school units in the upcoming year. We currently kind of build that number based on, for the school districts, it is the higher of a projected ADM or their prior year higher of the first 2 months. So if a school district is increasing in population, it is based on our projection. If they are not, then it is based on their prior year higher of the first 2 months. For for charter school and lab schools, it is slightly different. These are schools of choice, and it is not so easy to just determine a charter school size based on birth rates and migration and transition, because they have a cap often, or they're in high growth. Therefore, we ask the charter school and lab schools to provide us their anticipated number within what is allowable by law for their growth. We also kind of, to minimize our double counting of those students, we actually cap that budgeted growth by 20%. This does not impact the individual school, but it does try and manage that we are not double counting students in school districts as well as charter schools if that growth does not materialize. I note in here regional schools, they are also public school units. They are budgeted a little bit differently. That is a consortium of, we have one regional school, consortium of 5 school districts. That ADM is budgeted in those respective school districts. And then the residential schools, which does receive a direct appropriation that is not directly related to their student counts. For the public school unit themselves, how are they impacted by the allotted ADM? Their funding formulas are generated based on the higher of their projected or their prior year, just like I explained before. And then for charter schools, they are initially funded based on that projected amount. That's how much they receive in July, if we have a good year with a budget and timely. That is what we initially do. We obviously don't know the number of students they actually have in that school year, so that is what they receive in July. So for LEAs, they are adjusted a number of, really 2 main adjustments. The first one is related to charter schools. If they have a new or growing charter school in their district, then the budget is initially in the school district's numbers, and then we reduce them once we know the actual number of students in those new and high growth charter schools. And the funding is transferred, and that occurs in early November. So that is their first budget adjustment. And it is needless to say after the school has started. The second area is if their actual average daily membership is either higher or lower than their initial average daily membership. In those cases, we decrease if they are lower than their initial, then we reduce their funding by half the difference if they meet a threshold, and we only reduce them for about 75% of their allotment categories. So, and this reduction occurs in early December. So now we're getting halfway through the school year, and they are seeing budget reductions. If their numbers are higher than their initial, again, we increase their funding by up to that the actual average daily membership, the higher of the first 2 months, if it meets that threshold of 2% or 100 students, And again, they receive funding for about 75% of those allocations. And the reduction, the increases are done at the same time of the year in December. So for the charter schools and the lab schools, they are treated differently. As is stated, they are initially funded based on the projection they provide them, and their final funding is recalculated based on their actual month one average daily membership. This can be a challenge, especially for new charter schools, when they don't actually know, like if people say, yes, I'm going to come to your school, and then they don't show up, and then they have to call the next person on the wait list, it can be a real challenge for them for that month one. The funding is provided 100% of that per pupil allocation. So the issues, if you have not figured out, I alluded to them as I spoke through, is one, of course, it is an inconsistent treatment between the public school units. They are not being treated in a similar fashion. And the late budget adjustments are a real challenge, especially when you think of public school, the industry is 90% personnel from state funds. And so when you're trying to secure personnel, get positions, get your classrooms set up, and you have that budget uncertainty, it can be a real challenge in being able to secure staffing. And so some will hold positions, and then once the students come in or they don't come in, then they have to kind of make mid-year adjustments. So with so much of the budget and the allocations being determined based on projection, we have seen since since about 2016, a real challenge in being able to project accurately. And we have historically always done an incredible job, but with the increase in school choice, whether that's the increase in charter schools, of course, the cap was lifted in 2012-13. The increase in homeschool students, that has been a real impact on our projections. And then post-pandemic, which really threw out all historic data, it has made a big impact on our ability to get those projections correct, which can overly kind of request funds if we overproject, right? We are obligating state funds for amounts that we don't end up needing, which is, needless to say, not a positive. Charter schools, being an increasing number of students, they are now over, they're kind of in the 12% range, and that interdependency between LEAs and charter schools is it's a real challenge for both parties, both charter schools and for school districts. And the bottom line, I guess personally, the administration of all this is just, it is incredibly complex when you're bringing on new people and trying to explain. And it is often, we manage over $12 billion, and we're often moving, $10,000 here and there. So this is another reason for this focus on looking at alternatives. So the recommendation is really comprised of three components. First of all public school units would be initially funded based on their actual month two. We use month two just really for timing. Month two of the prior year. And so that would be your LEAs, charter school, lab schools. And then for the, we would then build into the budget a dollar amount for a projected increase, right? For those school districts that are increasing, we would build in a contingency ADM so that when we know what the real student count is, we can provide funding to those increasing school districts. And then new charter schools would be included in that ADM contingency. So how would public schools be funded? They would all the funding formulas would be initially funded using prior year month to actual average daily membership. And then how would they be adjusted? The adjustments, there would be and of course all these are recommendations, right? There are no adjustments to a school district for any new or growing charter schools. There would also not be reductions in the event that the current year ADM is lower. So in effect, for that 1 year, they would have a full year to make budget adjustments, readjust their staffing, etc., and would not receive these kind of reductions halfway through the year. And then all public school units would be increased based on their actual. So if their actual average daily membership was higher than the prior year, then we would provide them additional funding from that ADM contingency reserve. And for a school district, instead of right now when we do those budget adjustments, we're putting the money into all the different budget categories, right? So a little bit of for teachers, a little bit for instructional supplies, etc. And we're kind of moving all those funds. We would propose that for that 1 year, the growth funds would just go into one program report code. It would be a relatively open chart. The school district would have that 1 year to utilize those funds in, whether it's they need additional teachers, their textbooks, or whatever it is. And then we would incorporate those funds into the next year budget line items. So the funded ADM for the next year would be recalibrated to the actual. So if you were declining, you would see that decrease. It is not a hold harmless. It is a 1 year delay in actual funding the school district. And then, as I stated, those flexible funds for the 1 year, and when we build that base budget in the next year, we'll incorporate it into the appropriate categories so they would not have an increase in growing flexible PRC. So what is recommended to not be included in, did I miss a slide? I did miss that slide. That slide that I just missed was actually related to a new charter schools and lab schools that, as I stated, we would have them, we would initially fund them based on their ready-to-open student numbers as certified kind of or checked off by the Office of Charter Schools, but then they would actually be recalibrated to the actual month one. Those preliminary numbers from new charter schools can really vary a great deal. So in order for it to be kind of non-contentious for that first year to be actual month one. So there are specific categories that we would recommend to continue to be excluded from this funding. Exceptional children's funds, as you saw, they have a totally separate funding model, not any now and being recommended. They also, both exceptional children and limited English proficient funds are funded based on a head count of the prior year. So they already are in that funding in arrears, and so we would recommend that those are kept that way. They are also very restricted, right? So that by law. Driver education and school tech funds are actually receipt supported, so they are not incorporated into the general per pupil dollar amount. When we're looking at how much, as stated with the school districts, currently only receive like 75% of the funding, we would recommend that they get a full per pupil share of the dollar amount for each student if they were increasing. But that does not include the driver education and school tech funds. And then grants, it would have to be determined through that grant document as to how those funds were allocated. So that is the item for discussion. As I stated, we are currently calculating the impact, the budget impact of moving to a model such as this, utilizing the current year funding, the current year funding with the prior year average daily membership, and we'll have a better idea as to what the comparison would look like, in addition to what we would recommend for the contingency amount needed for the upcoming short session. We do expect to have our projections, which we will still need projections, right? Because we'll have to project out what the growth will be for specific school districts that are in growth. And we should have those numbers within the next 2 to 3 weeks.
All right, this is a discussion item that will come back to us next time, but it would be important if you've got any questions or comments right now to go ahead and share them, and then we'll go on to, I think we can close up fairly quickly after we finish with this item. Yes, Ms. Moore.
My head is spinning a little, so
I figured.
I'm gonna try to ask this, and hopefully it'll make sense. So when you're using a actual month ADM for a school system the year before, does that actual month ADM include all of the students that are in charters that are in that district?
No. All the public school units would be treated separately, and then we would remove that interdependency.
So then, when you carry that forward number to the next year, and you are incorporating charter schools into, new charter schools into that, does the new charter ready to open number get added to the ADM? Or is it also separate?
We would
It's
no
not
longer do
separate.
that. We would no longer incorporate, so if you had a school district that had 10,000 students, right, and they had a charter school that opened with 1,000 students, right now, we would kind of transfer those funds. What this recommendation is saying is, no, we're going to budget for that 1,000 students and hold that school district separate. We're not going to say, oh, well, because this happened, your school district is going to be reduced. That's the recommendation. So it obviously is double funding a student for that year. So there is a financial impact on doing that. But right now, the way we do have kind of we do have school districts that are funded for students that aren't there, right? We already have that in this model. So it's really looking at the financial impact of doing it in the two different ways.
And ADM is not the same, is the question, it's not a statement, it's not the same as enrollment.
That is technically correct, yes. Although sometimes people will use the term the same.
Right. Generally, would it be correct to say that enrollment is higher than ADM?
Enrollment is always higher than ADM.
Right, so schools are never actually funded for the number of students that are there.
That's may or may not be true. So in enrollment, the technical definition of enrollment is that if you go to a school, right, and then you leave, and that's one, and I go to that same school, that's one. Now there's 2 enrollments, even though you have left. Enrollment actually never decreases.
You're right, is ADM impacted by attendance?
ADM, it can be, but only if there is a violation. A student is in violation for more than 10 days, right? So in which case, so it's if I'm sick for a day, my ADM is not impacted, right? So there are cases, but generally that is not a big factor of average daily membership. The bigger factor would be and an average daily membership is not calculated by each student. Average daily membership is calculated as a aggregate of a grade within a school. So you have a lot of factors a lot of rounding, so average daily membership is not a real number of counting.
And those numbers come from the PMR?
It does. So membership last day is an actual head count, so which also comes from the PMR.
Thank you.
And here it is.
So why would the second month of the prior year be used to estimate the future year as opposed to a later month in the prior year closer to the beginning of the projected year.
Or the highest month of the prior year.
Or yes. Yeah, why the second month? Other
Well-
than that, we've always used that month.
We have. Second month does tend to, well, actually not always. There was a time when it was the higher of the third and fourth month. And then it went to the higher of the first and second month. We picked month 2. It does tend to be at a point where, it's not the first month, which is not stable and much lower than month 1 generally. Month 2 does seem to be quite a healthy and does tend to be one of the higher months for sure. Once you get past, into January, you've got like mid-year, graduations, you've got a dropout, you've got, so that it does tend to go down in the second half. It could be third month, could be the higher, we picked something. There's no magic to it. I would definitely not recommend first month, and I would not recommend anything after really November.
Other questions or comments? All right, thank you very much. This is a lot to think about, and I'm sure we'll have some more questions when we come back for this item next month. But thank you very much for going through it with us. And actually, thanks to your department, because you spent an awful lot of time up today between you and Jennifer, so thank you both very much. We are now at consent items, Biz Op Beta certification of 2 new finance officers, which we're excited about. Biz Op 9 is school bus routing equivalent system approval in Gaston County schools. There's an equivalent system that we have already approved on another occasion for another county that was going to be approved for Gaston County schools, and I assume there are no questions about that. Then we have updates on contracts. I've heard no questions on that. We have the update on the monthly budget report, and then we have one last presentation, and I meant to ask Alexis just to stay there, which is the ESSER 2 budget report. This will be a relatively quick report in terms of the ESSER 2 budget as it is being closed out since the ESSER 2 money ran out at September 30th of 2023.
That's correct. And so in your materials, you have 2 reports. One is a report on all the funding that got distributed out through PRCs to the school districts. These are ESSER 2, so we're talking the $1.6 billion in ESSER 2 funding. And then the other report is the funding that went out, that was administered through the department. So when we're looking at the school district, as you probably are aware, 90% of the funding went out by law, by federal law, in a very flexible bucket that the school districts got to determine how to best utilize those funds. And they utilized them almost to the fullest. You'll see in that report there are 2 columns to the right that show the reversions by the program report and then the percentage of the allotment that was reverted. So it was 0.02% of the school district's funds that were allotted, that were reverted, and 1% of the charter school funding. The school districts generally, public school units generally spent these funds on probably the highest items were computers, software, supplies, not surprisingly, 5% on HVAC, 10% on extended contracts, 17% on bonuses. That was the largest item. So a lot of non-recurring items that will help them in the transition into, obviously, post-COVID. The largest items that were reverted were actually in the summer programs, but even still, they were a very small percentage. Related to the to the items that were administered by the department, these are referred to as the state leadership money. There were 30 items in ESSER 2, and you will see at the bottom, the reversions were actually 0. We had a couple of items that we do expect to be zeroed out that were totaling $49,000. This is a great management feat from our budget team to ensure that we do not revert these funds, and was really we were able to do that because we were provided that budget flexibility to utilize, move expenditures from ESSA 3 down to ESSA 2, and we did that also from ESSA 2 down to ESSA 1, so to fill those gaps. And the biggest items, that's why you'll see kind of an initial budget and then the final budget. The items that were increased, meaning their expenditures were moved, were the letters training, the district and school transformation, and then the Office of Learning Recovery. Overall, the total amount that was spent on admin was about 0.3%. So that was obviously a very small percentage of our total funding. So as we look forward to the next year, we obviously have ESSA 3 that will expire September 30th of 2024. And along with these funds, we also have, not just these, but we also have, we have the GEARS funds, we also have EANS, which was $84 million to private schools that we administered, that is not illustrated here.
Any questions or comments? Thank you for that. We'll follow up on those other funds as the years progress, as this year progresses. Thank you very much. That concludes our report, Chair Davis.
Thank you, Vice Chair Duncan, and that concludes our open session agendas for today. We'll now be going into closed session. We will not be returning to open session at the conclusion of close, but we will be reconvening tomorrow, January 4th, promptly at 9 a.m. Now request a motion to go into closed session. Vice Chair Duncan.
I move that we go into closed session pursuant to North Carolina General Statute, Section 143-318.11, A, 1, 3, and 6, and to prevent the disclosure of information that is privileged or confidential pursuant to North Carolina General Statute Sections 115C-319 and -321 and 132-6.1C et sec. To consider the qualifications, competence, performance, or condition of appointment of public officers or employees or prospective public officers or employees, and to consult with our attorneys in order to preserve the attorney-client privilege between the attorneys and the public body, including a discussion of the following pending cases: Phillips versus North Carolina Department of Public Instruction, Henderson versus North Carolina State Board of Education and North Carolina Department of Public Instruction, Messick versus North Carolina State Board of Education, AB by RB and CB versus North Carolina School for the Deaf, Toomer versus State Board of Education, Miller versus North Carolina Department of Public Instruction, and Hall versus Lyles.
Motion by Vice Chair Duncan. Is there a second? Second by Ms. Kamnitz. Mr. Pafaria?
Dr. Oxendine?
Yes.
Ms. Kamnitz?
Yes.
Mr. Keenan?
Yes.
Mr. Hall? Dr. Tipton Rogers? Mr. Blackburn?
Yes.
Ms. Moore?
Yes.
Treasurer Falwell? Lieutenant Governor Robinson? Vice Chair Duncan?
Yes.
Chair Davis?
Yes. Motion carries. Let's be in closed session in 5 minutes, and we'll reconvene at 9 a.m.